letting me know that. So when my colleagues get on, before we start the meeting, and I just want to make sure I have Dave.
No, I don't see anybody but you and I right now.
All right, well, we'll wait till our colleagues get on.
I'm on.
There's Susan.
Thanks, Susan.
Rhonda, this is Miguel, just doing a mic check.
We can hear you, Miguel. Thank you.
Let's do a Miguel check.
So you guys understand what All right, so what we're doing today, I'm going to ask that everybody be on mute unless it is your turn to speak. So I'm going to, and I'm going to ask the staff to make sure that I'm a co-host on the panel. So if the staff can make sure that's the case, would be great.
One moment, Supervisor. We'll make sure that happens.
Thank you.
Done. You guys got me multitasking here.
Thank you. Thank you. And I'm going to again ask everybody to mute who is not speaking. And so just I'm going to do one quick housekeeping. We're going to start the meeting and then I'm going to do more housekeeping. So for my colleagues, each of my colleagues will have 30 minutes spread over question and answer today throughout the entire day. And what I've sent to all of you is a run of show, so to speak, that shows the end and start time for each panel. And at the beginning of each panel, I'm going to remind people that they really do only have 3 minutes. Some people haven't worked with us before and think I might be kidding about that, but they have 3 minutes. They're going to have their slides up, and we're going to move through this as efficiently as we can. If my colleagues will notice, if you look at the break, we'll take a break around 12:30. The public comment on the item will be at the end after 3G, and public comment for the entire meeting will be item 4 at the end of the meeting. And we'll do our best to stay on time. So and as a reminder to my colleagues, you all have your own stopwatches, so you can do your 30 minutes for the day, but we're also doing it here too, just so I can keep track of how we're proceeding. So from my colleagues, are there any questions about process today? No. Oh, Mike?
There we go. Yes, ma'am. When you said the 3-minute presentations, is that for the 3A, B, C, D? Is it for the people under 3? Is that what we're talking about?
That's right. Each
Wonderful.
panel is 3 minutes. Okay. So with that, I'm going to formally open the meeting to begin our meeting. And if I could, I'm going to ask the clerk to take roll.
Supervisor Ellenberg.
I am here.
Supervisor Simidian.
Simidian present, thank you.
Supervisor Cortese. Supervisor Cortese.
Here.
Thank you. Vice President Wasserman.
Here.
President Chavez.
Here. Thank you very
We
much.
have a quorum.
Thank you. I would like to ask all of my colleagues and the public to please stand for the Pledge of Allegiance. Pledge allegiance to
To
the
To the
flag
flag
of
of
the United
the United States of America
States
and to the republic for which it stands,
one
nation,
nation,
under God,
under God,
indivisible,
indivisible,
liberty and
with liberty, justice for all.
Thank you very much. So let me just introduce this. We're going to item 3 on our agenda, and this is the first special hearing of the Board of Supervisors relating to the economic recovery phases of COVID-19 and the plans and guidelines and needs relative to the safe opening of businesses and other institutions. I'm going to ask us Supervisor Simidian to join me in just a moment. But as you may recall, some weeks ago, which seems like forever ago, we entered into a contract with IEM in order to help the board support the efforts of organizations to safely reopen. As part of that, there were a number of components to that process. One was a series of interviews that IEM has been conducting with community leaders about what their needs are and concerns and challenges. The second was to create an ad hoc committee that I've been serving on with Supervisor Simidian to meet with our staff more frequently between board meetings, both to get updates, but also to be able to give reflections from the board and really from the community as we get a lot of concerns and emails. And a third part of that was to put together public meetings so that everybody could participate and everybody could hear what the opportunities, challenges, and struggles have been for people as they open up and as they begin to open up in different phases. The purpose of today's meeting, just for me to be very clear, is this. The Board of Supervisors are not the public health officer. The public health officer's job is to let us know, based on her best thinking and research, what part of the economy in our communities open up in what phase. But the role that the board has been playing is gathering information from the public and sharing that with the public the public health officer and the staff that are writing guidelines. The purpose of today is to make sure that we're sharing information, that we're doing this in a public venue. And so the hearing, the way it will lay out is that we're going to begin with comments from our internal team to talk about where we are in the process of opening, to explain the thinking behind the decision-making that's going on for our public health officer and other public health officers, and really for us to make sure that we're conveying information directly to the staff that are writing the guidelines. And, frankly, we have a lot of people who are going to be on these presentations today that have done a lot of thinking that we'd like to make available to other organizations that are opening up, because some of the work has been done by others that'll make it easier for them to have the guidelines that they need and not have to waste resources getting ready. So the agenda before you is very tight, and I'm going to stick to the timeline because everybody wants me to. And I apologize to any of the panelists or any of the speakers. If you start to take too much time answering a question, I'm going to intervene because I want to make sure we get as much information out to each other as possible today. So with that, I'm going to see if Supervisor Simidian would like to make any opening comments.
No, thank you, Madam Chair. I think we would be well advised to get right to it. So thank you very much.
Thank you so much. So we're going to move to item 3A and 3B, and this is to receive a report from the Office of the County Executive relating to the Santa Clara County Strategic Framework for Reopening and the Community and Economy, including information relative to indicators, protective factors, parameters that inform the shelter-in-place decision-making process. And for that, I will begin with Dr. Smith.
Thank you, Madam President. I think that we have a little slide deck here. I think the clerk can put it up for us, please. Well, while they're doing that, what at least we have planned from the staff perspective today is I'll give you just a brief introduction to the situation we're in. Then we'll turn it over to County Counsel James Williams, who will go over the public health orders. And then Sarah Cody, our public health officer, will talk about the plan that the public health officers have for taking care of our residents during this pandemic and reopening. Okay, so next slide. So each pandemic in the history of the world is different. This one is totally unique. It's the only time we've had a pandemic with a coronavirus as the initiator. It's obviously the largest population in the history of the world, and density is a big deal when you're talking about transmissibility in a pandemic. So I wanted to give you a little bit of a feeling of how dangerous pandemics are. This is a graph of the deaths during the 1918 flu pandemic. This is a pandemic that occurred with no specific treatment, really no medical system. Hospitals were very primitive at that time. There was no significant social distancing, and you can see there's 3 big spikes. The first spike really happens when the susceptible population is killed because of infection that happens on top of their comorbidities. Then as the virus prevalence in the community begins to build up, there's a lull, but a second spike when the critical mass of virus in the community is reached so that enough people are infected that everybody who's susceptible has a risk of death. Then that begins to fall off because as the population dies, so does the virus, sadly. And then the virus has to build up again, and there's a third spike because there's not sufficient immunity built up. Next slide. So really, in our situation, the only treatment for COVID-19 was social distancing and shelter in place because there's no specific treatment, there's no herd immunity, there's no vaccination. And at the beginning of this whole process, there was very little understanding about the transmissibility, the risks, the ratio of virus in the community, and ways to identify people who are at risk. Next slide. This is just a model to give you an idea of what the difference is or what the significance is of social distancing. You can see the top line is what the spread of a virus is like with no social distancing. Then the very bottom line is when you start social distancing on a theoretical day 20, and in between is starting on day 21. You can see that 1 day lag in the institution of social distancing means thousands of cases that are additional to the start. So social distancing is a very powerful tool, and that's why it was utilized initially for this particular pandemic. Next slide. Here's a model of what's actually going on in the state and in Santa Clara County. The red line is the cumulative deaths per 100,000 in the state of California. You can see that it's going up. It's not flattening out. It continues to be on the rise. It's currently at about 11 deaths per 100,000 in the entire state. And the blue line is our county, which you can see started out back in March, well, actually in February, being above everybody else. And then you can see about the middle of March, we instituted shelter in place because we were significantly above everybody else. And then it's taken some time to slow it down so that it crosses over the state line right around the 5th of May. And we're beginning to flatten, although there is a little tweak up at the very end, which is a concern. And if you look at San Mateo, they're also in the 10 deaths per 100,000 range. We're currently in the 7 range. shows the great risk that's involved if we weaken or relax shelter in place too fast. Next slide. Now we're turning it over to James Williams, who's County Counsel. James.
Good morning, members of the board and public. James Williams, County Counsel. I'm going to just take a couple minutes to try to outline, and I hope this will be helpful for the panels through the rest of the day and on Monday, kind of where we're at right now in terms of the shelter in place order, as well as the state framework under which we are operating. So I'll begin by talking about where we are today. This is a little chart that Public Health has put together around what's open. And I think the short version of this is that actually there is more that's open than not at this point. There was significant openings, and with the order on May 22nd, and then very significant ones today. Now, things that are open with conditions and with guidelines and with social distancing protocols, and I'll talk about that for a minute too in a few moments. The significant items that have always been open include all healthcare services, essential governmental services, essential infrastructure, and essential businesses. In addition, certain categories of outdoor recreational and other activities have always been open under the local health order. The significant things that have opened today include outdoor dining at restaurants, in-store retail, all manufacturing, warehousing, and logistics, as well as a variety of other services where there is not direct or sustained personal contact between people. All childcare and summer camps and guidance has specifically been issued with respect to summer camps and summer programs for children, and outdoor ceremonies and gatherings, religious gatherings, as well as expanded outdoor recreational activities. Again, social distancing protocols apply. There are criteria limitations focused on things like ensuring that there isn't crowding. So, density limits, for example, to protect both employees and customers in facilities. And I'll talk about some more of the social distancing protocols in a minute. Next slide, please. We're operating under a framework outlined by the state. So the state has its statewide stay-home order, and the state has this multi-stage process of what can open. The state right now is in what they call expanded stage 2, and this is a can be a moving target. The state is making modifications and changes as well, but we're operating within kind of that framework of what is open at the state level. These are the items open under stage 2 at the state level. And you'll see that basically these are categories of things that that have been open or are now open at the county level as well. So this first set are essential services. Most of these are things that are essential businesses that have been open under all of the shelter-in-place orders, both state and local, including across the Bay Area. Next slide, please. And this is pulled again right from the state's COVID website, which is their roadmap. And then all of these categories of retailers, all of which are now open as well for in-store retail here in the county. I think the simplest way to describe it, there's a lot of complexity. State has guidance for different industries out there as well. I think the simplest way to describe it is that there is, by and large, alignment, not just here at the county, across the Bay Area, and across the state. And most of the sectors that are open there's alignment, but maybe some different criteria. Next slide, please. One of the criteria pieces that's local is our social distancing protocol. The approach that we have taken, and this was revamped with the order that took effect on May 22nd to try to make it a more user-friendly document, is a requirement for all facilities to have, and it's facility specific. There's a detailed document that goes behind this kind of visitor information summary sheet where training and information needs to be provided to employees, where steps need to be taken to ensure that people can maintain appropriate social distancing in facilities. So based on square footage and based on the other kind of physical constraints of a facility, where appropriate sanitation, cleanliness, facilities are made available, but also steps are being taken in a facility. Each facility operator is required to really customize that protocol for the unique situation in their particular facility. And then for certain categories of businesses, the order itself has additional applicable criteria. This visitor information summary sheet, along with, next slide please, the COVID-19 prepared sign, are required to be visible at entrances to facilities so that the public can know that those steps have been taken. It provides information on how to file complaints or concerns, both for workers as well as for customers. And face coverings are also a part of the requirement for anyone accessing any open facilities in the county. So it's really the social distancing itself, the face covering piece, and then the cleanliness and other practices along with the appropriate training and protocols to go with it. We are asking businesses to customize the detailed protocol for each facility. And then, like I said, if you look at the appendices in the order for certain categories of businesses that are now opening, there are specific kind of broader criteria that are applicable. In addition, the state has issued industry-specific guidance documents. And wherever possible, we have absolutely tried to harmonize those pieces into what's happening locally to try to facilitate making things as efficient as possible, as easy as possible for folks. We've been doing a lot of outreach on these protocols, especially because they were revised significantly effective May 22nd. And so we know there were a lot of people who were open under the old ones who need to now update their protocol to reflect the latest revisions. And so we continue to really push this and emphasize this across the board, because the goal here is to have a kind of cultural norm around these best practices that really need to be in place to keep us safe. And I'm now going to turn it over to Dr.
Good morning. This is Dr. Sarah Cody. Thank you so much, Madam President, members of the board, the public, and all of the panelists who will be speaking today. What I want to do is give you an overview and context for the reopening plan here in Santa Clara County. And before I do so, I just wanted to highlight a couple of items that James just mentioned, really to highlight their importance. The first among that being face coverings. All of our orders, of course, do require face coverings when in a business. This is really important as we move forward, the face coverings and maintaining a distance of at least 6 feet. That's going to give us a lot of protection as we move forward. So before I discuss our reopening plan, I just want us to remember our overarching goal, which is to prevent COVID infections to the greatest extent that we can. And that's so that we can prevent death and enable business, healthcare, education, and all other sectors that are reopening to be safe and to feel safe for the patrons and the patients. And finally, to protect vulnerable communities who are at the highest risk of exposure, hospitalization, and death. So as we reopen, our plan is to keep this overarching goal in mind as we make these tests of change. So the way we proceed is that we make a change in the order, and then we follow the indicator trends. Then we wait to see if we have enough headroom to move forward, or if we need to hold, or even if we have to go backwards. And please remember that these indicators are measures of change, but they're not triggers. So overall, our plan is to take small steps at a time, because it takes 2 to 3 weeks at a minimum to see the impact of the change that we've just made. So on the left-hand side, you can see our indicators. They're also up on our website, and they're designed to help us do 3 things. Number 1, they tell us how the disease is spreading. That's indicator 1, where we look at the number of cases in the community to see that they're either flat or decreasing, and the number of hospitalized patients, which we also want to see is flat or decreasing. Number 2, we look to see if we have enough resources to detect disease and to control it. So that's our lab testing and our case and contact tracing. Those are indicators number 3 and 4. And finally, we look to see the indicators tell us if we have enough of a reservoir to care for people if they do get sick, either with COVID or something else. And that is our indicators 2 and 5. Next slide. So we have on our website a dashboard which enable the public to see how the county is doing, how are we collectively doing as we reopen and make these tests change. You can see this on our dashboard. I just want to highlight a couple things. This is a screenshot of the way the dashboard looked yesterday, and you can see up there how many new cases we had reported to us on that day. That's in red. And if you look down at the bottom, also in red, you see the new cases by day, and that's by the date that the specimen was collected. And what we're looking for is to see that tail there on the right. We want it to stay pretty flat. We're looking for about the same number of cases every day. It's going to bounce around a little bit, but we want to see that flat. The other part that, of course, we want to see is that we want to see that the new deaths per day are 0. Yesterday, that was the case. To the right of this, where you can see how the cases break out by race, ethnicity, you can see it by age, and you can see it by zip code. And this is because we want to see where do we have any worrisome concentrations of cases or deaths by particular populations, so that we can focus resources and protect people to the best of our collective ability. Next slide. This next slide is another indicator. This is the indicator, again, I was mentioning that we have an indicator to let us know whether we have enough resources. This is to detect COVID. This is a dashboard that shows laboratory testing, and there's 2 really important things to see here. One is just how many tests are being performed in the county in a day, but just as important is to look at, of the tests performed, how many are positive. So across the top there, you can see the overall test positivity rate of all the tests that have been performed in the county. But what's really important to see as well is, of the tests performed in a day, how many were positive. That's the positivity rate. And in our county, that has been slowly decreasing. It's now just a little over 1%. So it's important that we hold that positivity rate low, as well as ensuring that we're testing the populations where we have the most concern that COVID might be spreading. And finally, on the next slide, we can see and we follow our hospital utilization. So this tells us, 1, whether our hospitals have enough resources to care for COVID patients and others. And we, of course, we never want to be in the position where we have very many COVID patients. We never want to be in the position that we've seen some of our colleagues be in other parts of the country, and where we thought we might be in late March and early April, where we were thinking through crisis standards of care, how to build makeshift hospitals, how to build makeshift nursing homes. We don't want to go back to a place where we need to be planning for those types of disasters. We want to keep our hospitals and clinics safe so that people can come in, whether they have a heart attack or whether they need cancer treatment or whether they're coming in to give birth. We want our hospitals and clinics to be safe. So this is really the final indicator that we watch. I also, before I turn it back to President Chavez, I want to note that this, of course, is a lagging indicator. So we wouldn't see, as far as looking at our tests of change, we can't understand the impact on hospitalizations until usually about 3 weeks after we have made the test of change. And we are watching this indicator very closely. We're beginning to see a little bit of an uptick in our hospitalizations, which likely reflect the easing that we did in the middle of May. Thank you so much, and I'll
Maybe I'll jump in here for a little closing, President Chavez. I just wanted to emphasize to everyone how dangerous and unique this pandemic has been. It's only been 4 months since the first identified death in the United States. In that time period, 108,000 individuals have died, which is almost the same number that died in the entire World War I, which was 116,000 US soldiers. So it's an enormously dangerous virus. And I think that the people of Santa Clara County, because of their attention to shelter in place and social distancing, have done a fabulous job at temporizing and shortening the number of deaths and injuries caused by infection. And we're in a great place, but we also have to be very, very careful going forward as we reopen. So with that, we're done.
Thank you. And I wanted to just say, I know for my colleagues, this has been a repeat, but I wanted to make sure that we began this hearing with a framework that people understood the process by which the health officer is making her decisions along with other health officers. And also just for panelists and folks who may be watching today, that is a very different group of people than we've had participate with us up to this point. Just a couple of things that do any of my colleagues have any comments or questions? I don't see any. So I'm gonna move on to begin the panels. And what I would like to do, I'm gonna remind everybody a little bit about the process that we're gonna use going forward. Please ask presenters to turn on. Okay. So you want them to turn their screens on. Okay. So okay, so what we're gonna do is we're gonna ask everybody but the panelists. We're gonna ask the panelists to keep their screens on. And what I wanted to let you know is you're gonna see a panel from Amy Nguyen, and Amy's gonna keep your time. And so let me just say a couple of real quick things. Just a reminder, the goal of the hearing is to learn from our community institutions who some have safely opened and how they're doing it, how they will safely open, and what services they may need or support from the federal, state, local government, or other institutions. At the end of these hearings, IEM will be packaging up the written product that we've gotten, the slides that we've gotten, and the public testimony for the board and the health officer so that we have access to that information. We're going to hear today from a very comprehensive list of leaders from our community, from both from the economic side of it, sectors, and our community. Each panel will last 45 minutes. Each panelist will have 3 minutes to make presentations. And for the panelists, I'm pretty disciplined about stopping you at 3. So you stop yourself or I will help. The board members, just as a reminder, will have 30 minutes to ask questions and receive comments throughout the day. And that is really so that we can make sure we can fit as much information as we possibly can into this. And also, I just really want to thank my colleagues and all of the panelists who are going to be joining us today, and everybody who's listening in, because, you know, we're going to get out of this by working really closely together and making sure we can proceed effectively and efficiently. You'll see, we'll start your time as you begin to speak. And I know you also probably have your own timers. Let me begin by going to panel 3. This is item 3C on my colleague's agenda. And I'm going to introduce our panelists. And our panelists are going to speak in the order that I've introduced them, in part because the slides are structured that way. I'm really pleased and honored to introduce many from this panel we connected with by working through the Silicon Valley Leadership Group. And I'm really excited to see them participating with us today. Steve Jostin, who's the Vice President of Global Site Services and Facilities for Infinera. Wendy Rinzo, VP Operations, Fujifilm and Dymatics. And then Kim Rasheen, Director, Environmental Health and Safety for Genentech. David Beeney, Executive Director of the Santa Clara and San Benito Counties Building Trades. Keith Praw, Vice President of Operations for Block Construction. Doug Richards, Executive Vice President of Administration for SunPower. Jared Miller from Stevens Creek Lexus. Jim Araby, Director of Strategic Campaigns for United Food and Commercial Workers, and Ryan Iwagawa, Chief Experience Officer for the Sereno Group. And you'll notice that this panel is a panel that either there's been complete opening or we've been in the process of opening. So with that, I'll start with Steve. Steve, you're on mute. Okay, we got to keep him off mute. Go, welcome.
Good morning, everyone. Infinera, go to the first slide, please. Infinera is a provider of optical networking equipment that helps power the internet around the world, and as such, we have a large international presence. We are in the essential business, and as such, we have been running our small fab in Sunnyvale to support our global customers throughout this period. We've been dealing with COVID-19 since Sunday night, January 26th, when we were alerted to an outbreak in China at our Shanghai and Beijing facilities. And on January 27th, we formed a Tiger team to address the situation and reviewed our business continuity plans. The executive leadership team was also engaged at that time. Early on, we recognized that there was potentially, next slide, please. Early on, we recognized that there was potentially a huge issue at hand, and we mobilized very early in the process. We created this Tiger team of senior managers that were on call 24/7. Site services, legal, HR, and the site leaders were added so we could address topics at local level quickly. We set a rigorous and thorough communications cadence for collaboration, material creation, and global implementation. And so when the county order to shelter in place was received, we had already taken many actions to reduce our risks. Next slide, please. We look at this process as a multi-phase journey we're on, and the minimum on-site staff requirements were met to meet business needs in phase 1. We took lots of precautionary actions to reduce the risk and spread of the COVID, and all other employees were asked to work from home as the county order came down. The SOP for our fab operations included extra sanitation, limited occupancy, temperature scanning at single entrances to the facility, mandatory face coverings at all times, and a huge effort in employee responsibilities. The personal health monitoring was important, and reporting what to do if they're not feeling well. Social distancing was emphasized, and personal precautions like hand washing, do not touch your face, and all those others were implemented. Next slide, please. Our approach to the new normal is we are going to be implementing these global principles. Employee safety is a priority. Deliver our infant era experience and live our culture. Local implementation, transparent communications, and regular tuning of our processes. Next slide, we just go through these quickly. This is our internal global communications that we developed. Next slide. And the next slide. And this slide actually shows you the regional training guidelines, the SOPs for all over the world that we've created using a standard template. So that can conclude my my comments. We've got more work to do as we re-enter the work environment going into phase 2. But this is what we've done so far.
Thank you. Wendy?
Thank you. Thank you for inviting me and providing this opportunity. If we could have my second slide. While that's being prepared, I'd like to reiterate that we are committed to socially responsible leadership at Fujifilm Dymatics. As Cindy knows, at least we sort of met via email. When the outbreak occurred, we began immediately donating our PPE to local hospitals. What you'll see today is we continue in that unwavering commitment to the safety of our community and our employees. Sorry, could we hold the clock until I have my slides, please?
Yes, thank you.
Great, thanks, sorry. Next slide.
Start it over, Shannon.
Great. So we're manufacturing silicon-based inkjet print heads. Our customers are located all over the world. 75% of them are actually deemed essential by their countries. We have 3 buildings, 2 fabricators, 250 total employees, but 125 production employees that work 24/7. Our employee density is quite light, again, because we do have a night shift, for example, and we are in the process of fully reopening today. Next slide, please. I want to spend a minute on the nature of our manufacturing. We are in, I guess the foundation of Silicon Valley was the silicon-driven clean room. We have 100% HEPA filtered air, which is 99.7% effective down to 0.3 microns. We have over 600 air changes per hour. And the airflow is from ceiling to floor, which really prevents any transference of contamination particulates from human to human or human to product. Our employees wear literally from head to toe, personal protective equipment, including their own personal suit, gloves, masks, face shields, and shoe coverings. Next slide, please. Since time is of the essence, I just want to hit a couple of high points in our process of reopening safely. Although we meet the density requirements, we have created outdoor break areas. We have staggered our shifts such that our change of shift does not become overcrowded or congested. We have replaced all the filters in our HVAC system to assure good quality air in the offices. We have walk-through screening devices on order and handheld thermometers throughout. I have personally trained all 250 people in our COVID-19 protocol and had them sign documents of understanding. We continue with monthly audits planned by our quality group for assurance. Next slide, please. We are a secure access building, and we're in the process of developing software such that when employees check in, we can accumulate health check information, which can ultimately be used in case we need to do contact screening. Next slide, please. And although it will be an eye chart, it is an eye chart, it's just to give you a feel of the breadth and depth of the improvements we've made very deliberately to assure employee safety. Those improvements range from individual screening to retraining on personal hygiene and re-emphasizing the availability of employee assistance programs through these difficult times. Finally, and lastly, we are passionate about our documentation, keeping it up to date, and shamelessly borrowing from others, and I look forward to hearing more about that today, best practices in making them their own. Last slide. And again, thank you for this opportunity today.
Thank you, Wendy. Kim?
Good morning, all. Thank you again for the invitation to be here with you today and share our return to campus plan with you. I'm representing Genentech and also the lead of the COVID-19 task force. Next slide, please. As we are considering our return to campus, we've focused on two primary guiding principles. One is, how do we protect our people and the communities in which they live and work by prioritizing their safety and health, while adhering to local, state, and federal requirements. Next slide. As we start to bring folks back to our campus, we have put many considerations into effect to make sure we're doing that in the safest way possible. We have just implemented phase 1, and we're about to implement phase 2 by the end of this month. And that is returning back all of our folks who couldn't do their jobs from home. A lot of our laboratory staff had been sent home during the height of the pandemic. And so we're now starting to bring those folks back. And as we do that, we're considering both internal and external factors to do that safely and effectively. What is the case rate? As Dr. Cody mentioned earlier, we want to see that flat or decreasing. Availability of PPE. Are our staff, very importantly, are our staff adhering to the guidelines that we set forth for them to be safe and healthy? And then we'll be moving into future phases, bringing back non-essential staff or office workers, and you see additional factors there. We expect there to be about 5 phases of our return to campus. Next slide, please. As we start to bring those folks back to campus, as you're seeing from some of my colleagues, there's a new normal. So we're reacquainting folks with the campus. What does it mean to work on site? What do we expect from them, and what can they expect from us as their employer? And we're doing that through a multitude of communication vehicles. The most important in that, I think, are the regular messages and virtual office hours our executive committee is holding with all of our staff. Next slide. And I really wanted to share what we feel are the most important success factors for all businesses safely coming back up into full operation. Childcare and schools being open, available, and safe is critical to allowing our employees that flexibility to get their work done. Remote working, having strong infrastructure. We've heard about supply chain of PPE. I'll add to that also cleaning supplies. We're still struggling with some of those items. Getting our folks back to an innovative culture, making sure we have a good, solid, safe, and healthy public transportation system so that we can minimize our environmental impact as folks start to commute back to work. And then finally, again, back to what Sarah Cody was mentioning earlier, is testing and contact tracing being widely available and robust in our communities so that our folks can return back to work safely and know whether or not they've been impacted by the virus. Thank you very much for the time. I appreciate it.
Kim, thank you very much. We're going to move on to David Beanie, Executive Director of Santa Clara San Benito Labor Council. Dave, you're on mute.
Thank you.
All right.
Good morning, President Chavez and members of the Board of Supervisors. The Santa Clara and San Benito Counties Building and Construction Trades Council represents the over 30,000 men and women of the unionized construction industry for this area. Next slide, please. For construction workers, safety was job number 1 long before COVID-19. Of the top 10 most dangerous jobs listed by the Bureau of Labor Statistics, 4 of these are within the building and construction trades. Every day on the job is a risk, and the unions who represent these workers have made safety a part of the culture. Because of this, the construction industry was well positioned to incorporate viral safety into the daily workflow, not just to protect construction workers, but also to protect the general populace while construction work continues. Next slide, please. Being one of the first industries to be considered for opening was considered a critical responsibility for us. We knew we had an obligation to get it right, not just for us, but for the other industries to follow. Next slide, please. The measures we have instituted include, among other things, some clear and detailed signage at all points of entry and any areas where workers might gather. Next slide, please. The supply of appropriate personal protective equipment to all workers and a zero tolerance approach to their proper use at all times. Each task is evaluated separately for the PPE that might be required specific to that task. Next slide, please. We've also instituted a screening protocol for every single person who enters the construction site, every single time. If a worker steps off site, even to go to their vehicle, they must be re-screened to be admitted again. Next slide. And of course, social distancing. Many construction tasks have this built in, and those that don't have been reorganized or scheduled differently to accommodate the requirement. All of the daily safety meetings, the break areas, and the crew rally points are enforcing strict social distancing requirements. Next slide, please. Construction workers have had to make some serious adjustments for viral safety. And for those with union training and support, the transition has been a smooth one. The ongoing safe performance of construction work has been built on the strong partnership between contractors and labor. This partnership has made the shift in how we work much more smooth than it might otherwise have been. I receive daily reports from union representatives about the construction sites that are complying with the protocols. Even minor variances are immediately corrected. I have been extremely pleased with the results, and I look forward to the safe reopening of all the other sectors and a revitalization of our economy. Thank you.
Thank you, Dave. Keith Craw, Vice President of Operations for Block Construction.
Good morning, ladies and gentlemen. Thanks for having me. Block Construction, next slide, has entered its 50th year, and what a year it's been. If we go to the next slide, please. Got a great shot of some construction workers there wearing their PPE. Go to the next slide, please. Off the bat, a lot of our projects were considered essential, so we've been working since really March 19th. Next slide, please. And with that continued working during that period, we had a number of challenges. As a number of folks have said, just that anxiety around working during COVID-19, that moral also obligation to make sure we weren't continuing to spread the virus while we were working. There are cases in construction where social distancing is a challenge. Maybe there's a 2-person lift or you're working on scaffolding together, so sometimes you may have to get within 6 feet. So we had to think about that and how to deal with that. Also, construction industry, like a lot of industries, a lot of folks are motivated to come to work sick because they only have a certain amount of vacation days. And so we had to think about that as well to retrain our folks to not be so macho. If you're sick, don't come to work. Next slide, please. With that, we put together our own protocol, especially during that period of after March 19th, before the B1 and B2 appendices came out. We really had to put together our own protocol. And I want to thank the county health and the CDC. The websites were great for, there was just simple, easy to understand information where we were able to put together protocols for our workers to make sure we kept them safe and help stop the spread. And having those put in place really gave a confidence to our workers that they are going to work safely. Next slide, please. You can see here the typical types of PPE that we're using. A lot of it, there's the face mask, which we were self-fabricating, as well as the face shield for when there was issues where we had to get within 6 feet, so they were fully protected. Next slide, please. And then since I'm running out of time, I'm actually just going to run to my next slide. I'm going to go to my last slide. I really just want to say what can be helpful moving forward to us in the construction industry. Next slide. 3 things that we want your help with is one is continued support on the permitting and inspection process. In a lot of cases, we've actually accelerated construction, so we really need the permitting agencies of the county and the municipalities to continue moving forward with us. We'd be happy to help virtually and actually think about going virtually for inspections moving forward, as it'll probably save 25% of time so that those inspectors aren't driving back and forth. And then to reiterate one of the other panelists' comment about reopening school and childcare centers, our workers have to be on site and they have to have care for their children and good education, and that's going to need the supervision of a school. And then again, just encouraging commute from home or working from home, so we're minimizing the commute so our traffic issues don't remain like they were prior to COVID-19. So thank you very much.
Thank you very much, Keith. We're going to go to Doug Richards, the Executive Vice President and of Administration for SunPower.
Morning, Board President Chavez, members of the board. Thank you for the opportunity to speak before you today. I'm Doug Richards, Executive Vice President of Administration at SunPower Corporation, a Silicon Valley headquartered company with about 7,000 employees in offices, manufacturing facilities, at residential, commercial, and utility construction sites around the globe. I'd like to start by thanking President Chavez for her leadership on the issues discussed today and acknowledge the responsiveness and helpfulness of her team. We've seen activities over the past weeks as a productive and great example of a strong public-private partnership. Like others, and that you've heard from today, we are affected by COVID-19, and currently, for our U.S. workforce, about 85% of our employees are working from home. We are fortunate that the resiliency and tenacity of our employees allowed us to quickly and effectively switch to this mode. We're also fortunate to have our manufacturing operations back online, including our pilot manufacturing line here in Santa Clara County. This is in large part due to the work of this board. Additionally, your thoughtful and necessary stay-in-place measures and rules allowed us to get our solar installers back out at sites and working in ways that allowed for no contact with our customers. At SunPower, we're taking a phased approach in our work resumption plans, which is returning our employees to offices. Our current phase 1 means that a large population continues to work from home. In the second phase, scheduled to begin June 15th, only about 25% of our population will return to offices in a limited staggered reopening of sites. And our plan is that at this time is that this phase will go through September 8th. An important aspect of defining SunPower's new normal is having established procedures in place, those already implemented at operating facilities around the globe, including health checks, safety screening, temperature checks on entrance, wearing face coverings, personal protective equipment, and ensuring social distancing. As we have these requirements, we're also balancing this with employee privacy rights. We know that this pandemic is unpredictable in where it spreads and if there'll be a second wave. Our leadership team is actively engaged and continues to monitor COVID-19 situation. We're prepared to adjust plans as needed, and the guidance and work of government entities such as yours plays an important role in how and if and when we would adjust. So thank you for the opportunity to speak before you, and I'm happy to answer any questions.
Thank you very much. We appreciate you being here today.
Thank you.
We're going to move on to Jared Miller from Stevens Creek Lexus.
Yes, hi. Thank you to the Board of Supervisors, county staff, and Dr. Cody. Let me begin by saying I cannot imagine the level of discussion and debate that's taken place over the last 10 weeks, and we appreciate all of your efforts to help keep Santa Clara and our local community safe. Today, I'm here to represent not only Lexus of Stevens Creek, but also the Silicon Valley Auto Dealers Association, and to share insight in our dealer operations, along with the impact COVID-19 has had on our industry. If you can go to the next slide, please. So from the start of the shelter-in-place order, automotive dealership service operations were deemed essential. This allowed us to help serve the needs of our community by ensuring they had reliable and safe transportation. Through this effort, dealers did what we do best. We innovated. We saw the need and demand to protect both our team members along with the guests we serve. We swiftly adapted by moving the majority of interaction with our guests to our service drives and executed touchless drop-off procedures, mobile service, and pickup delivery. We implemented social distancing protocols, extensive safety and cleaning protocols, trained team members on the proper use of PPE, and implemented health checks to keep everyone safe. Next slide, please. Through these learnings, we're able to adapt and safely implement outdoor sales under the revised shelter-in-place order. This was a huge win and allowed us to bring back valuable jobs and help contribute needed sales tax revenue to our local cities and county. In sales, we shifted to an appointment culture. We allowed guests to test drive vehicles remotely, initiated as much of the process as possible to a digital retailing platform. The problem we continue to face is an antiquated DMV regulation that still requires part of the document process to take place in person through the signing of wet documents and wet signatures. We know that a vehicle purchase is the second largest purchase the average person will have in their lifetime. Conducting this in an outdoor manner for the last month with the different weather fluctuations we experienced in the month of May, from high winds to 96-degree heat to rain, was less than optimal for this level of a purchase experience. We appreciate the new updated and revised shelter-in-place order that went into effect today. So we're happy to report that we were able to reopen our sales operations. We're implementing a lot of the processes that we learned through our service operations over the last 10 weeks into our sales with the same use of personal protective equipment, social distancing. We've spaced out our showrooms, but the big thing that we wanted to stress, if you can go ahead 2 slides. There you go, is the amount of traffic going through our showrooms daily. It's far less than what we've experienced through our service departments, and the 80-20 rule means that 80% of our operations take place on a showroom that's 80% of our total dealership square footage. So we think we can safely operate with social distancing, and we appreciate the opportunity to prove that this month and onward. So thank you, everybody.
Jared, thank you. And I know you had to pinch hit, so thanks very much.
Not a problem.
I'd like to welcome Jim Araby, the Director of Strategic Campaigns for UFCW. Welcome.
Thank you. Thank you, President Chavez and the rest of the Board of Supervisors and county staff. My name is Jim Araby. I'm the Director of Strategic Campaigns for UFCW Local 5. We represent 30,000 workers throughout Northern California in primarily all the industries that have been deemed essential. 90% of our members have been working since the beginning of this crisis. We have about 8,000 of them here in Santa Clara County. And I have to say that Santa Clara County has been one of the most proactive counties out of the 13 counties we've been in. So we really appreciate that leadership. As you can see, we, from the very beginning, were able to negotiate a side letter agreement with our major employers. Our approach to this crisis has always been that labor, employers, and government have to partner together to protect the essential workforce. We were able to negotiate expanded paid leave for 14 days for all workers impacted by the virus. Guaranteed PPE for our members. And then we began to work at the state level as we expanded paid leave for all essential workers. We also worked and helped get expanded workers' comp to cover workers who contract COVID-19 at work for essential workers. And we worked with Cal OSHA to expand the guidelines to cover the work in the grocery industry. Can you go to the next slide, please? We believe there are still necessary next steps. We've had a lot of struggle. We've had over 100 of our members contract the virus. We've had 2 of our members die as contracting the virus in the workplace. The average age of a grocery worker is about 42. We have 15% of our grocery workers over the age of 55, which is the higher risk category of workers, of people to contract the virus. We think individuals should continually be properly trained on the proper application of PPE, and there should be readily available PPE. And we think that safeguards should be in place. This is the one place we've had a real struggle with, is safeguards should be in place when a worker contracts the coronavirus in the workplace. This is our stance. We think all workers should be notified and allowed to be tested and given paid time off while awaiting their test results. Workers who contract the virus should be given immediate relief for 2 weeks and then go on workers' comp and unemployment thereafter. We think the store should be closed for 24 hours so that proper sanitation procedures can be applied, and that all the emergency orders that have been put in place, including expanded paid leave, workers' comp coverage, and everything else, should be made permanent. The reason why we're really pushing on this issue is because when we've had our workers contract the virus, there's been inconsistent approach in the grocery industry in particular. We've had some grocery stores closed for the 24 hours, bring in whole new crews and follow the protocols that we recommend. And we've had other grocery stores that will only close a department down, keep the rest of the store open. And then we've actually had, we will see as the contract tracing gets up in further whether this is the best way to move forward. We think these are good guidelines as other retail sites open. And I just want to say thank you for inviting me and open to answering questions. Cindy, I think you're on mute.
Thank you. Our last speaker is Ryan, and he is the Chief Experience Officer for the Sorrento Group and also a pinch hitter. So thank you again for joining us.
Hi, everybody. Good morning. Thank you very much, President Chavez and the members of the board, for asking me. I unfortunately didn't have time to put together a presentation. I found out late last night that I was requested to speak, and I'm grateful to be here. I'm representing the real estate industry and Sorrento Group specifically. And I guess the one thing that I have to say is that we've had the benefit of being deemed an essential service about 1 or 2 weeks into the shelter-in-place order. And so that has given us time to become accustomed to trying to work within the parameters of the health department's guidelines. It's been an ever-changing process, and we've worked very hard to comply with kind of the changing orders as they've developed. The steps we've actually been preparing for reopening since the beginning of May in anticipation of that. And as I said, our experience with working as an essential service helped us kind of prepare for the initial day. We've been open as a company officially since Monday, very much like all of the rest of the speakers today. We've implemented in-office guidelines, protocols that closely follow or that adhere to the county policies and guidance. The one thing that does make our real estate, the industry, a little bit different than a traditional job is that most of our quote unquote employees, which are realtors, their place of business is actually at clients' homes, typically as a listing. So not only do we have to set up a protocol for in-offices, but we've worked hard to set up best practices for the listings that we take. Our industry basically adheres to a no open house policy. Showings at our available listings are by appointment only. And then there are strict before and after showing protocols that require agents to make sure that the home is sanitary and prepared for the next showing. If I could ask if there's one request, maybe I would just ask that the board consider consulting with our industry because of the nature of our realtors and the way that they do business. Oftentimes, a blanket universal policy is not necessarily applicable apples to apples in our industry. And so it always helps when we have a voice at the table when people are trying to figure out how to navigate life after shelter in place. It's been smooth so far, a little bit bumps here and there, but we're optimistic about the future. And I just want to thank everybody for allowing me to speak.
Thank you very much, Ryan. I'm now going to go to my colleagues to see if there are any questions for members of this panel. And I'm going to ask my colleagues if they could raise their blue hands.
No, ma'am.
None?
Nope.
Okay, we're good. So thank you. We're going to wrap up this panel. I do want to say to this panel in particular that that Stephen, Wendy, and Kim, and Doug, your company, SunPower, that I just want to say thank you to all of the work that you did on behalf of the whole community. What my colleagues may or may not know is the leadership that all of you played in getting PPE and ventilators at a critical time when we were terrified. And I want to say a very, very sincere thank you. And then also to the rest of the panel, almost all of you worked really closely with us to help us think about the next steps that we would be taking. And we just really appreciate your leadership, your kindness, and your openness to share information with the county. So thank all of you very much. We're now going to move to our next panel. And this is 3D. This is our office workspace panel. And if I could ask that, what I just found out from my colleagues is everybody needs to close their screens down? No, we're fine. Okay. So if I could get the panelists for the next panel, and I'm going to ask if you are not on this panel, if you could open your windows if you are on this panel, and if you're not on this panel, if you could close your window. I'd like you to stay with us, but only because it allows the clock to move further up and easier for your colleagues to see it. So with this panel, this is a panel work related to the safe opening of office workspaces. And this panel, we have a number of folks. I just want to make sure everybody's here with us. Great. We're going to begin with Greg Woodcock. And Greg Wook, the founder and CEO of Pinger. And I'll go ahead and start with you. Make sure everybody can see the clock, and we'll go ahead and get started. Thank you.
Thank you, Madam President. I appreciate the outreach that you've done through the Silicon Valley Leadership Group to companies like mine. It is very, very helpful. Next slide, please. Pinger is a small company. We're located in downtown San Jose. We've been at the corner of 2nd and San Fernando since 2004. We are largely an exempt employee base. There are 95 employees that are located in that location. We provide communication applications to tens of millions of end users and hundreds of thousands of business subscribers. And we've been working at home since before the shelter-in-place rules went into effect. And we intend to continue to work from home. But we will open in service of employees commensurate with changes in guidelines. The good news for a space like ours is that it's very open, it's conducive to distancing. We've got multiple floors, it's easy to keep people apart, there's multiple entrances and exits. Next slide, please. So we have a variety of things that we're trying to do. But again, my point of view today is that the virus is still there. It hasn't changed. We're going to keep people away from the workplace as long as we can because we actually don't have an economic imperative in returning to work. What I have is an employee accommodation. So I have tens of employees that are stir crazy who can't separate their personal and their professional life anymore, or they've got to get away from their roommates, or they've got to get away from their four walls in their studio, or maybe even take a little sheltering time away from the family. I'm not going to go through the myriad of things that we're prepared to do. They look a lot like the things that you have set out in guidelines or heard from other companies. If you want to go to the next slide. Where we could really use the help is we could use the help on the testing and the tracing. I think for a small company like ours, we will continue to swim in the wake of larger and more sophisticated companies. But in the area of testing and tracing, if there's software or a website or a central location to make it easy for my employees individually and privately, or my HR department to assist with an outbreak and how to help the county understand where that outbreak could go through tracing, that would be my ask.
Great. Thank you, Greg. Thanks for your involvement and your leadership. We're going to go to Irving Tan. He's the Executive Vice President and Chief Operating Officer for Cisco. Oops. Is Irving with us? I do not see him.
Let's see him in the panel.
Okay, thank you. We'll come back to him. If I could ask for our colleagues to go to Fran Palacio, the Financial and Administrative Services Manager for the County of Santa Clara.
Yes, good morning, and thank you, President Chavez and Board of Supervisors. Next slide, please. The county as a governmental entity has continued to provide essential services to the public. We've learned much during this time and have identified alternative ways to maintain these services while keeping employees and the public safe. This has proven to be beneficial to reconstitution efforts. The county will not reopen beyond these essential services until like business and service providers are allowed to reopen by the county's public health officer. In preparation for this reopening, a cross-departmental team was formed. Next slide, please. The team has identified to date a total of 8 return to on-site work objectives. These objectives are being worked on simultaneously. We've inventoried and categorized the over 300 county facilities and are determining priority and timelines for sanitation. We will work with facilities and fleet and/or contractors to initiate, ensuring that all prescribed CDC guidelines are adhered to. We will implement cleaning and disinfecting protocols for all county officers prior to reopening. County departments were asked to catalog backlog services to determine those that needed specific plans. We are prioritizing these services, determining initial timelines, and will work with departments on their specific plans. We look to partner with the learning organization to develop our employee plan, which will address and explain all the changes needed to return on-site in this new normal. The client plan will act as a resource for county offices relating to educating clients and the public through the use of public communications, such as news releases, social media, and the placement of on-site directions, banners, signage in parking lots, facility entrances, and in public areas, drop-off and pick-up procedures and related protocols. Next slide, please. We will partner with our FAF space planners to develop a spatial plan, which will consider revised protocols and best practices for congregation areas, such as conference and break rooms, the addition of plexiglass and other physical barriers, markers designating at least 6 feet spacing, and increased considerations for elevator capacity. We will identify sources to procure needed PPE and will establish timelines for delivery to departments. This will ensure that county offices possess the needed PPE for when employees return to on-site work. We have identified existing employee communication resources, with the primary one being the Bridge, an employee connection SharePoint site and the source of a weekly employee communique. We will establish a county reconstitution return to on-site work section in this communication. The county's facility security director and a member of our team will lead the endeavor to address security and safety and security concerns. Prior to the county's reopening, safety security protocols will be developed and implemented. Thank you, and this concludes my presentation.
Thank you very much. We're going to go back one to Mr. Tan. Thank you for joining us.
Thank you, Madam President. Madam President, Supervisors, I appreciate the board giving me the opportunity to speak today about Cisco's return to office framework. Can you move to the next slide, please? Before I provide a high-level overview of our framework, I just wanted to note that all of the decisions that we have made in extending access to offices, resuming travel, meetings, and events, first and foremost, have been informed by our employee safety, health and safety considerations, working in conjunction with our medical directors around the scientific and medical data at hand, and also, most importantly, adhering to official guidance in terms of the authority to open offices and also in relation to the needs of the business. This framework has been developed not only in partnership with our industry peers, but also taking in terms of input from consultants and other relevant stakeholders as well. Next slide, please. So turning back to our return to office approach, we have a three-phase approach. Phase one will result in about 30% of our workforce coming back in, and predominantly roles that are what we call facilities dependent. Phase two will involve an expansion of the population of people coming back up to a maximum of 50%, and these will extend beyond roles that are purely facilities dependent to roles that will require people coming together, particularly around roles that involve innovation and creativity. And phase three will involve the office fully returning back to normal operations, of which we were operating at about 63% on average occupancy of our teams coming back in. Before entering phase one, all of our employees will be required to complete an online training course in regards to the office health and safety measures that we have put in place in relation to COVID-19. This involves things like wearing of face coverings, the need to access a daily symptom checking app that they need to self-certify, and ensuring that we're abiding by the appropriate physical distancing requirements as well. Only identified employees that fall into the categories of facilities dependent will be required to come in phase two. The rest of the organization will continue to work from home. As we move into phase one, as we move into phase two, that identified employees list will expand, but again, the rest of our employees that are not identified to come into phase two will continue to work from home. In addition to my comments today, I would also encourage the board to review the Silicon Valley Leadership Group's protocols for high-tech companies, as they too have recommended a phase approach strategy. Thank you for your time and giving us the opportunity to share with you our framework and approach on returning to office.
Thank you very much. And I will make sure that we share that information as we've been working with the leadership group on it. So thank you very much, Mr. Tan. We'll now go to Erin O'Brien, the CEO of Community Solutions. Welcome.
Good morning. Thanks very much. Community Solutions is a nonprofit human service agency. We serve about 8,000 clients per year out of 3 primary sites in Santa Clara County. We also have 4 additional staffed residential programs that staff work out of. About 90% of our staff are office-based and about 10% are in the residential programs. Being an essential business providing critical behavioral health and safety services, we have never closed, but we had to quickly shift to doing an almost entirely remote workforce, providing primarily telehealth services to our community clients. And part of what helped us be successful in that was supporting a really flexible work schedules for staff so they could balance their multiple roles they were juggling with and then really over communicating. So we heard what was going on with clients and our staff's needs, and keeping the staff informed of the evolving regulations and protocols. So I think that we kind of put all of the precautions in. Next slide, please. Actually, you can advance another one beyond that, please. Following the guidance that kind of you've heard about universally. But we did early on in advance require masks and minimize congregating, no waiting in waiting rooms, and moving the break rooms so that staff wouldn't congregate there. And also having staff take their temperatures and wellness checks before coming into the business. We are very hesitantly and slowly moving towards some return to bringing more people into the office, but we do not have any plans at this point to bring all of the staff back. We're developing a survey for staff to see who wants to return to survey, because many do. But many of our staff are liking the flexibility and are actually more productive even working from home with that flexibility. We're also assessing staff who needs to return to the office to be more effective, because working from home has significantly impacted their efficacy. But we will, as I said, be looking at both of those, bringing minimal staff back into the office as needed and as they desire, but really we'll be keeping it to a minimum for the indefinite future. We are shifting our client services more to face-to-face with the nice weather that's happening. We are encouraging staff now to see clients outside, but while maintaining social distancing and all the PPE requirements and everything. Next slide, please. So I think that that's kind of just some of the stuff that we're looking at forecasting. Next slide, please. The challenges that we face in working with an office-based work is that we have not had some staff are very compliant, but some are not taking the precautions as seriously. So we're having to do walkabouts, changing the procedures to take temps so that we're ensuring that they're done every single day. We've also developed, it's a draft form at this point, a guidebook for staff returning to work that I believe that is available in case that's helpful for anybody, but we will be really laying out clearly for employees what's required when they come back on site.
Thank you, Erin. We're now going to go to Judy Miner, the Chancellor, Foothill De Anza Community College District.
Thank you so much for inviting me today. Our colleges have been asked to prioritize the programs and numbers of students and employees and the dates and times that various rooms will be needed in the 3 locations that we serve throughout the county. Right now through June 30th, in preparation for our summer session that begins June 29th, we are confirming that there's adequate PPE. We are undergoing training for our employees in the required protocols regarding health checks, sanitization, physical distancing, and contact tracing. We have assignments that will be established for building responsibilities that will include required signage, maintenance, security, and trash removal. Also, sanitization of classrooms and bathrooms will be assigned so that the responsibility is clear. And we do have the fire department doing a check right now regarding any vegetation that could pose a fire risk, and we're getting that cleaned up in the next week. Our summer quarter going from June 29th through August 8th will involve staggered readmission to the campuses for students, faculty, and staff. And the staff will be pretty much limited to instructional support, custodians, gardeners, police, business services, and technology services. At Foothill, there will be limited access to labs for dental hygiene, respiratory therapy, radiologic technology, and pharmacy technician programs. At De Anza, we are grateful that we do not have to let our nurses back on campus thanks to Valley Med, who have provided them with the necessary preceptorships, so that the 6th quarter nurses will be graduating in about a month's time. And we are also keeping our design, manufacturing, technology laboratory open 20 hours a day, 7 days a week, as they are producing face shields, face shield headbands, and adapters to help connect 2014 era hoods to the current powered air purifying respirators. We hope to have possibly limited childcare in the Child Development Center at De Anza. At the Sunnyvale Education Center, we will have EMT paramedic training faculty and staff who will be able to complete their programs. And for the fall quarter, most courses will be online for both colleges. Some classes may have an on-campus component. And again, there would be staggered readmission to the campuses for students, faculty, and staff. Our main concerns always are around PPE, having sufficient staff, adequate funding. And I would like to echo some of the comments that I had heard earlier about COVID testing and contact tracing that could support the work that we do in order to provide a safe workplace and a safe study space for all of our students. Thank you.
Thank you very much. We're now going to go on to Nicole Johnson. She's the head of corporate and social responsibility and executive director of the Pure Good Foundation for Pure Storage. Welcome.
Thank you. Thank you for having us, President Chavez, and to all of the supervisors. A quick introduction. We are a high-tech company based in Mountain View. We also have additional offices in Sunnyvale and employ about 1,330 people locally. Next slide. Thank you. So since March 13th, our offices have been primarily closed, although some of our work is deemed essential business. So a very limited number of people have been in the office on an as-needed basis. We do look forward to this next phase of reopening with a focus on the health and safety of our employees. We've been able to pivot to a primarily digital workforce for most of our functions, but some of the collaborative and innovative work that we are known for is necessary to do in person. So we're currently only planning on bringing back people who have opted in to coming back. And those people will be on an AB week to week, week on, week off schedule. So of those 1,330 employees, 454 have opted to come back. And so those will be in AB groups of 227 each. As you can see, we are looking forward to complying with all of the guidelines around health and safety, including daily health checks, daily enhanced cleaning and health stations on each floor, 6 feet social distancing at all workstations and in any movement around the office and in to and from the office, requiring and providing PPE for all employees, and implementing a contact tracing system for all returning employees. So next slide. Thank you. So what we need from you, we thank you for everything you've done to keep our community safe and healthy during this time. We recognize that you're working in unprecedented times and on unprecedented issues, and really appreciate that our community has stayed safe, as safe and healthy as it has. Our ask of you are 2 things. One is when we have had people come back to work, even on those in the small essential business, the flexibility to remove the face masks at desks as a low risk business with the proper social distancing protocols met is going to be important for getting those innovators back in the office. All of our common areas where eating and drinking occurs are going to be closed. Our conference rooms are going to be very limited, and people are going to need to eat and drink at their desks. They're going to need to take Zoom calls from their desk, and all of that can be difficult with the face covering on. So we do ask that, and that you continue to monitor the public transportation so our employees can come safely to and from work. Thank you, and I'm open to any questions.
Thank you, Nicole. I have my... Thank you very much, Nicole. We're going to move to Denise Solis. Let me see if I see Denise. I do not. Let me just ask staff if they could take a quick look for Denise.
Unfortunately, I do not see Denise in the room. Let me look under attendees just in case. I do not see her there as well.
Okay, well, we'll come back to Denise if she joins us later. I want to go to my colleagues and see if there are any questions or comments on this panel. And I'm looking to see from my colleagues if I see any blue raised hands. I do not. I want to say a very big thank you to all of you. And again, I just really appreciate the leadership of so many of your organizations in helping us really fight this. And each of your companies, I think has done something amazing. I really do just want to call out Cisco Systems for the leadership that Cisco's played in making sure that the most vulnerable in our community had the resources to survive, especially when COVID-19 initially hit. We're still in ongoing phases on that, but I do want to say a very special thank you to Cisco and also to the leadership group that really helped us with this. So thank you. We're going to move on.
Madam President, you're muted.
Thank you so much, Mike. Mike's my champion there. This next panel is focused on elementary, preschool, childcare, and summer camps. And what I'm gonna, just as we have new panelists come on, I'm gonna ask that as you speak, if you could please put on your screen. And I think all of you, if you put your screen on, you can still see the clock, but the idea is we wanna make sure you can see your timer. And the other is just a reminder that we're asking people to present in 3-minute buckets. And also a reminder, all the written materials are going to be batched and put together by IEM and conveyed to our county staff, but also the body that's responsible for any issue that you raise that isn't directly within our purview. We'll be sharing those documents with other levels of government. So with that, I'm going to invite up Jolene Smith as our first panelist on this item. I know we're a little ahead of schedule, so I'm going to give folks a moment to join us. And so this panel has, we'll start with Jolene Smith, then move to Dr. Marianne Duwan, then to Lucille Gabrielle, Sandy Berlin, Marie Bacher, Dr. Deborah Flores, and then to Juan Cruz. So if I could invite those panelists, and I will begin with Jolene Smith. And Jolene, you're on mute. There you go.
Okay, great, thank you. Good morning, President Chavez and respected board members. My name is Jolene Smith, CEO of First 5 Santa Clara County. You can start my slide, please. You can start my slide, please.
So you want the next slide?
Yes. Yes.
There you go.
Thank you. Can I start back with my time? COVID-19 has placed the early care and education programs in crisis. According to a UC Berkeley Center study, 67% of child care programs across the state said that they would close permanently without financial relief. As a point of reference, the California child care industry generates $25.5 billion a year. It is a critical infrastructure for large businesses so their workers can go back to work. Some members of Congress are proposing a child care bailout, just like other industries such as auto and airline. Twin bills have been proposed by the U.S. Congress that would provide $50 billion to cover operating expenses, to incorporate new safety measures, and provide child care cost relief for families. Last week, the California Assembly and Senate presented their combined budgets that rejected the cuts to child care proposed in the governor's May revise. In the New York Times article, a child care center owner shared that as a result of COVID-19 health and safety protocols, she went from earning $2,000 a month profit to losing $20,000 a month as a result of implementing the protocols. They cannot stay open. Even though the pandemic, finding affordable childcare was always a challenge and a struggle for many families. Before COVID-19, there were 1,986 childcare sites open. Currently, only 415 remain open, resulting in a 79% closure of childcare sites. Even though the 415, we have done what we can to provide resources for them to meet the mandates. Pre-COVID, approximately 74,600 children birthed through age 12 were in care. With the closures, we are only able to serve 1,375 children. Without financial relief that creates stabilization for childcare systems, we run the risk of 50,000 children in our county with no access to care. In California, the childcare industry generates $25.5 billion of economic activity yearly. Losing 67% of childcare programs would create a $17 billion financial loss for the state. In addition to the impact of childcare systems, family budgets are strained due to long-term shelter in place. The rise in unemployment rates has placed the additional financial burden on families who are already worried about how they will pay for childcare. Our collective recommendations for the development of a plan to reopen childcare includes 4 key strategies. Continue our advocacy strategies with the proposed federal and childcare bailout, Create a childcare stabilization fund designed specifically to support childcare centers to financially reopen and provide them the stability to keep their doors open. Create a childcare assistance fund for the county's most vulnerable children and families. This fund would support families who do not qualify for federal and state subsidies and cannot afford the full cost of care. We must engage in robust public and private and business partnerships where everyone contributes to the stabilization and sustaining childcare as part of the economic recovery plan for our county. Thank you for your time.
Thank you very much.
My slides didn't change, Cindy. They're stuck. So I'm Madam Chair.
I think they just didn't know to turn them, but the board will have access to them. And they all have them right now. So we all have that material. Thank you though. And may I go to Dr. Dewan? Has she joined us yet? I do not see her. I'm going to move on to Lucille Gabrielle.
I do see Dr. Dewan on.
Oh, okay.
We want to know what our budget contribution, what our contribution is, and maybe it's something about how we compare.
I think what we're going to have to do is, Dr. Dewan, are you having a hard time coming on?
Probably, but aren't we the same?
I don't know if she knows she's, I'm going to just text her real quick. See if we can get her. All right. We'll just give her 1 minute to join us. And then after Dr. Dewan will be Lucille Gabrielle. So let me see if she's able to join us. If not, we'll go to Lucille and then we'll come back to Dr. Dewan. Is Lucille available?
Yes.
Wonderful. Lucille is the Director of Family and Children's Programs for the YWCA. Welcome.
Thank you so much. That's the wrong present. Oh, there we go. Okay. So here's the YWCA. We're a multi-service hub, but my role is to speak on childcare. We can go to the next slide, please. We have been open through all of COVID-19, providing childcare services to essential workers in the city of, or the county of Santa Clara. So part of what our implementation process was to follow the guidelines outlined by the CDC, which wasn't a far stretch from community care licensing regulations. It was just increasing some of our protocols. So new was practicing a ratio of 1:12, which is the same as community care licensing, but keeping the groups stable with the same teachers is where we had to pivot a little. Temperature checks now became touchless. Wellness checks were always done. Increased hand washing, sharing of meals, toys, equipment, and then the difficulty is maintaining the social distancing of 6 feet. So we do that when possible, but lots of the times it's 4 or 5 just because we don't have the space. Can we get the next slide? We have guidelines for staff members to be able to do self-regulatory checks at home, checking for fever, respiratory symptoms, asthma, any things of that nature, and they're encouraged not to come to work. So the teachers are encouraged to self-screen before coming to work, but we also have those screening measures in place before entering the building at the child care center. We're having children practice the consistent hand washing, social distancing, avoiding touching faces, and also chicken wing and coughing into the sleeve. Can we get the next slide, please? We are, our Classroom surroundings have changed. We're engaging in activities that don't require close contact, increasing distance, and not requiring children to stand in line. The next slide, please. The most important was our cleaning protocols that have been increased. Tables, doorknobs, frequently touched spaces. Children also using materials. Once they've used them, they need to be sanitized before they can be put back on the shelf for the next child to use. And then tables, chairs, all of those after every activity is now being sanitized before the next group changes over. And I think those are all of them. So thank you so much for your time. Appreciate it.
Thank you, Lucille. Sandy Berlin Walker, the CEO of the YMCA. Welcome. Sandy, you're on mute.
Thank you, President Chavez, and all our supervisors and panelists. I'm glad to be here today. Next slide, please. I just want to remind everyone that the YMCA is a multi-service center. When here since 152 years ago we started, usually over 100 sites, 10 facilities, and various programs throughout Santa Clara County. But after the orders came down, all the schools closed on, was it March 16th, or the Friday before, and we had to quickly pivot. We went from 1,955 employees to 85% of those folks full-time and part-time being furloughed. And we stood up 3 critical care sites. We converted to working with Title I schools to serve meals every day to kids and families through Drive Up, senior meals, educational support and distance learning, and virtual programs for all the health and wellness and social emotional learning. To keep serving kids and families during this time while kids were home and not in childcare or camp. Next slide, please. And so now on Monday, we pivot again. We're going to continue and expand our feeding sites so kids that aren't in camps or in school-based programs still will have access to food. We think it'll be 15,000 meals a week, including snacks. And we're going to build out and open on Monday 8 YMCA childcare camps. This is for kids 4.5 years of age to 12. And we are pleased to say we think we'll be able to accommodate up to 500 kids at our YMCA facilities, but that's only 25% of what we normally do in the summer. Next slide, please. As my colleague from the YWCA just outlined, all the safety protocols and temperature checks, the staff will all be trained in this and are already completely trained for the launch on Monday. Keeping older kids distance is a little bit easier, but not allowing them to share equipment or materials is challenging. And we're going to maximize outdoor time as much as possible. So we're grateful that we do have outdoor space at our YMCA facilities. But in order to serve more than 500 kids, we're maxed out in the facilities we control. So we'd have to be accessing school campuses again, which is not the case today. And I think that covers it. Of course, masks and slide and everything. Now, finally, I'd like to share with you, next slide, what our challenges are and what we need. Enrollments are limited, so therefore parents are not going to have as many options. It's tough on staff, but they're doing great. Parents are going to be strapped in funding, and the program is going to need help with external resources to fund parents to come back to work and have safe childcare. The predictability of when the orders change is really difficult to move this giant machine of staff and a delivery system, and we're going to need licensing flexibility. And as the school year begins, we're going to really have to be shared decision makers in how we serve kids and complement the school day. Thanks so much.
Thank you very much for joining us, Sandy. We're going to go back to Dr. Dewan. If we could go back to the superintendent's slides.
Thank you. Good morning, everyone. Thank you, President Chavez, for the invitation today. And I want to thank the Board of Supervisors for their interest in this topic. It's been a very challenging time. So what I wanted to share today are just, next slide, please, some of the keys to reopening schools, and affirm that our office has been open with essential personnel from the beginning. We've also been operating childcare, supporting meals distribution, and also school supply distribution to sites. The keys to reopening are included on this slide, but to really support in-person instruction, we will need some supports, both state and locally, and assistance with modifications of the orders. I want to recognize the importance of childcare. Our childcare is open, and considerations for our schools will be different based on the age and stage of children. Many of the practices that were shared earlier are also incorporated into our program, so I won't review those. Next slide, please. As we gradually reopen, we are guided by some key principles, including safety and equity. And we need to understand the disproportionate impact of some of these factors on different ages of groups and different communities, and also our schools and how they're funded, they're funded very differently. Next slide. It's likely that we can assume that those who were struggling when school was in session have continued to struggle with distance learning. And if that's the case, how our decisions to continue to operationalize equity moving forward will be important to both our budget and also to our plans for safe operations, knowing that children may be moving back and forth between distance learning and in-person instruction. And younger children will need different supports for instruction than older students for how they learn to become readers, for example, versus independent readers. Next slide. Our office has prepared detailed action planning templates and have a detailed table of planning considerations that are available for any schools. Some of our needs include access to personal protective equipment and resources for those. There are a number of uncovered costs that will be really essential to our operations. And some programs, for example, do not receive state revenue, such as our Walden West program that serves students. And then there are uncovered costs in childcare and other settings that we would need both state and federal support in order to safely operate in-person programming. And lastly, just want to verify that we do have a table of planning considerations with links that we provided. And we have been able to safely operate with health checks at entry. Currently, our employees are all wearing face coverings. They are adhering to physical distancing, and we have also been alternating schedules, including lots of opportunities for work from home. Thank you very much.
Thank you, Dr. Dewan. We'll now go to Marie Bacher, the Director of Environmental Education at Walden West School and Camp for Santa Clara County Office of Education.
Can you hear me?
Yes.
Okay, good, great. All right, I'm Director of Walden West Outdoor School, and we've been around for about 70 years. We, during the school year, do a 5th and 6th grade residential. And we've owned and operated this property here at Saratoga since 1982. The other programs that we offer are our summer day camp and our outreach, which is a growing garden. So we serve about 10,000 students in a school year. Since can you go to the next slide, please? So the big piece here is summer camp. It's what we create our revenue from. This is my son's summer camp badge, and he went through the leaders in training. And so, the biggest piece about summer camp for them is they just want to have fun. And he says this on this badge like 4 times. So, so campers, are going to need this time during the summer to connect with nature, solve problems, and playfully enjoy this summer. And the same things that everybody's been talking about with the health protocols and everything apply to us as well. And so we've made our changes with that. Could you please go to the next slide? So the need for nature during and after COVID is that time outdoors promotes good health. And so we know this because when kids are out, they're able to develop their gross motor skills. And, when they're out, they also develop just being more active and physically fit. Time in nature supports the children's happiness. And so we want them spending time outside. Unstructured time, which is what we do for summer. And, it's just good benefits. And then regular time also boosts their academic achievement and kids who spend time outdoor learn to care for the environment, so which is a big part of what we do. So a lot of our program considerations were also, we surveyed our staff and our parents. And so, and normally we serve about 2,000 children during the summertime. Since our closure in March, we've definitely have a decline of that enrollment. We had about 975 families sign up. And then we've been doing refunds. And so we will only be able to serve, because we're going to be open for 5 weeks, about 540 kids, hopefully. And so this part that's really hard is that since we've been closed, we haven't been able to run outdoor school. So there's a $1.4 million shortfall there. And then usually we make good revenue during the summer to help us out with the outdoor school. And already we usually make about, we gross about 500,000 or $1 million, and we only make about 500,000. So anyways, but thank you so much for letting me present and listening to us.
Thank you, Marie. We're now going to go to Dr. Deborah Flores from the Superintendent of Gilroy Unified School District. Welcome.
Thank you. Thanks to the—
My God, 3 minutes go fast.
I know, the slides, I'm hoping the slides keep me on track. Thank you to the Board of Supervisors for convening these hearings and giving us an opportunity to speak. So the impact of the shelter in place on not just Gilroy Unified School District, but all school districts in our county. We've been closed for 12 weeks since May 13th. And today is our last day of school. During this time, we provided the following essential services. We have 11,200 students that are in distance learning. We've distributed 3,500 computers, put in place 350 hotspots, and provided hard copies of materials for those who don't have an internet connection yet. We're serving 4,000 to 5,000 meals per day, and that's served at 7 school sites or transported by bus. So far, we've served 320,000 meals. And then the other essential services that we're providing are district office functions, custodial, landscaping, and upkeep. We're going to be starting a summer school program. It's a reduced program of only 3 weeks. We normally do 6, and that begins on June 12th. Thanks to the leadership of Dr. Dewan and the planning process that she's conducted with school superintendents in the county, I formed a planning committee about a month ago, and we've been meeting in the full planning committee, 30 members, and then 3 subcommittees that I would say were listed on the screen, but they're not there, sorry. So the subcommittees are health and wellness, operations, and teaching and learning. The committee is planning for two scenarios. There's a third one, which would be full reopening like we used to offer our school programs, but we're focused on 2, which is 1, full distance learning in students' homes in that event that occurs in August. And then the second is a blended learning model, which would combine some home and distance learning instruction at home and some in-person instruction at school. And we're waiting for the Santa Clara County Public Health Department to indicate later this summer which of those 2 options will be available to us, but we are fully planning for either. You asked what our needs are going forward. The impact of COVID-19 has been costly. We've already tallied $674,000 in cost, and that doesn't begin to cover what we're going to spend. For instance, we're installing plexiglass barriers in 20 buildings this summer. Additionally, we're facing a 10% reduction in funding from the state due to the crisis. The most significant need in our district is computers and hotspots. The digital divide is significant when 60% of our families are disadvantaged. Meals also are a critical component that we're providing. Again, many of our families need this service, and that's why we're so committed to continuing it with no interruption, by the way, through the summer. And the district has had some success acquiring PPEs, but if we're going to have students and staff return, we have 1,100 staff and 11,000 students, we're going to need more PPEs. And specifically to the Board of Supervisors, we'd like to request that funding for SLS and PEI continue. We have so many families that are in crisis, and those two programs have served them so well, and we hope to see the funding continue. Thank you.
Thank you very much, Dr. Flores. And now we'll go to Juan Cruz, who's the Franklin McKinley Unified School District Superintendent. Welcome, Juan.
Good morning. Thanks. Thank you to the Board of Supervisors, President Chavez, for having me today. I will, if we can go to the next slide, I'll just echo what has already been said in regards to the challenges, and this is thanks to Dr. Dewan and the team that put out some guiding principles and guidelines, and this is what we're using to have our school district consider what are the options for us. And as I was mentioned before, we're considering a full distance learning. We know we have some staff and some families that are already concerned that they will not want to come back in person in any kind of model that we choose. So we're developing a full online learning opportunity for those for that staff and for those students that are going to engage in that. And certainly, if we have the ability to do in person, our team is looking at the different scenarios that we can be able to open under those conditions and requirements of social distancing, small groups, and so forth. So we have a lot of planning to do, and once we decide on the model, then there's a lot of other implications: facility use, cleaning, and also how do we address the social emotional needs of adults and children when they come back. That is a major piece that we're having to plan towards. We have issued 650 hotspots and 2,500 devices, and we've continued to provide meals as well. So one of the things, one of the asks that I would have is we're hearing that there's a lot of challenges of our families in our TK and Kinder programs, or they're trying to enroll in our TK and Kinder programs around immunization. And they're having a hard time getting appointments and so forth. So I would look to some opportunities for us to be able to target families that are in need, for us to be able to provide that, so there's no barriers for enrollment for next year. And as well as I was said earlier, in terms of just the digital divide and how do we make sure that that's a systemic solution to that. And also, I will just say that we're grateful as a district to be an SLS and Universal Access pilot district, because we were able to pivot very quickly because of those partnerships and those services, and our families have been supported in a much greater way than if we hadn't had those systems in place. And so I asked the board to continue to partner with us and ensuring that the safety nets for our families are there, especially during this very difficult time. And then the next slide was just in terms of the numbers that we're trying to look at in terms of how many students we'll be able to have in the classroom. And, so those are the guidelines that we're working with as we prepare for next year.
Juan, thank you very much. And I want to thank all of our panel. And I particularly want to say just a really sincere thank you to this panel, because you kept going to work and kept things going for families and kicked into feeding thousands of people, what you're doing every day. And we're just really grateful for the partnership with all of you. What I wanted to do is see if there are any comments or questions from my colleagues for this panel. And I don't see any hands up. I think I just have one kind of next step question. Supervisor Cortese, did you have comments on this one?
No, other than a continuing thank you. It's been a great set of panels so far, and when I don't have questions, that means the presentations are excellent. Thank you.
One thing that I was just going to raise is that I know one of the panelists talked about schooling services, and I think that was Dr. Flores. And one of the concerns that we have is that the way the state is handling their budget crisis is to look to the counties to to take, frankly, property tax from us. And one of the challenges that we have is that we're looking at approximately $107 million of our ongoing general fund that the state would like to take back from the county. It would impact the city of San Jose at a tune of about $11 million a year. And the programs I'm most concerned about that would impact would in fact be programs that we expanded, like schooling services, the Office of Labor Standards, or other programs that are relatively newer to the county. And so one of so there are two issues I wanted to raise. One is we look forward to advocating collectively with you and everybody who we've had on the panels. We'll communicate with you about what help we could use. But the second is that I'm really interested in better understanding the next steps as you think about provision of basic things like food, because as we come out of this economic challenge, it's not going to get better right away. So any of you who are providing food services, I wonder if you've thought about what that would look like when school is back in session. Because I know right now you're feeding lots of people beyond the students.
Well, this is Sandy from the YMCA. I'll weigh in, but my partners around this call, you may want to complement this. If the schools don't go back in session, I would anticipate, I think we'd have to watch to be sure that schools would still have their funds to do food, and we'd have to do drive-through distribution like we did since March. But Superintendent, does that ring true to you? Do you think that would be how we proceed?
Well,
this is Dr. Flores. We plan to, as I said, we're not going to have any interruption in service. So we're going to continue all through the summer. We closed today. We're still serving meals right through the summer, even at a cost to our general fund, because 60% of our families depend on those meals. They come every time we serve the meals, and we're serving 4,000 to 5,000 of those a week. We will continue to do that in the fall, whether we're in distance learning or we're in, have some children back, or both, which we anticipate is most likely. So far, we've received the funding that we normally receive. The question is, will that be changed or reduced going down the road? We hope not, but right now we're planning on that funding. Unfortunately, we serve double that normally when we have all students in session and some of them pay. So that's why it's costing us money to continue to offer the meals that we are, but it's well worth it.
Thank you. Any other comments from Superintendent Cruz?
Yeah, I'll just add that we will continue to provide meals, and even if it costs us from our general fund. I mean, the meal program is already sometimes cost neutral, or we end up having to contribute from the general fund anyways. And that's an obligation that we have to our community, so we will continue to do that, as well as continue to partner with Second Harvest Food Bank. We offer 8 of our sites as pantry distributions, and we've continued to do that during the closure as well. And we hope to be able to continue to partner with the city of San Jose. We've been providing now on Friday adult meals for the weekend for the full family. So, we know that in our community that is a need, and so we will work with all partners to make sure that our families don't go hungry.
Thank you. Dr. Dewan?
President Chavez, I just wanted to add that the complication for us will be in the fall when we may be potentially serving some families in person, some children in person, and some not. And so our districts will have to ramp up in the flexibility of which we are providing meals, so that we're feeding children who are in school as well as those who may not be. And then additionally, just how we can stabilize the availability of staffing and support for our meals programs. Many of the districts where they're struggling is not in the USDA reimbursement for the meals themselves, but really the staffing costs to sustain the program. So we're working collaboratively to try to address all those solutions countywide. And I do want to congratulate all of our districts who stood up meals programs immediately at shelter in place. And so we've had meals available to families countywide from the very first day.
Which I have to say, it's just been, I think, one of the best successes of the whole COVID-19 has really been the school systems and the way you stood up right away. And I want to thank all of you very much for that. I don't see any other comments from my colleagues. I will say that last Tuesday we had a discussion about food. I know this is a discussion we're going to continue to have with the city of San Jose as they're playing a leadership role in the coordination of that and what the next steps look like. I'm more concerned about what this looks like more via the fall than I am even right now. So I'm going to thank this panel very much, and we're going to move on. We had one person who missed a previous panel, and that's Ms. Denise Solis, and we're going to hear from you next, and then I'm going to see if there are any other questions from my colleagues. Let me just, as Denise comes on and we get ready for her, I just want to do a little time check and let my colleagues know that we are ahead of schedule. I hate to even say it out loud because, you know, that usually is when it all goes to heck in a handcart. But what we're going to do is we're going to take a break after this presenter and any questions for any other panelists that were on in the morning that are still here. We'll take that break from approximately 11:45 to 12:15. Each of the panels in the afternoon, the final panel knows that we asked everybody to be on 45 minutes early, so we think that'll work for that last panel. For those of you who are listening who would like to weigh in, the time for public comment on item 3 will be after the 3F panel and when we get to the 3G discussion from the board. So we'll now turn to Denise. So Lise, welcome, Denise. And Denise was part of the panel for office openings.
Thank you. Thank you, President Chavez, Board of Supervisors, panelists, and I appreciate the time consideration, and I apologize for being late. I wanted to speak today specifically about SEIU United Service Workers West proposal and how we've been thinking about our role and and more in particular our members and workers' role in the reopening of the economy as it relates to workspaces. SEIU United Service Workers West, we represent about 50,000 private sector service workers. The bulk of our membership perform janitorial and security services in a variety of settings and workspaces, office buildings, school campuses, high-tech and biotech campuses, hospitals, manufacturing, and even some residential buildings. In Santa Clara County in particular, we represent about 8,000 workers who work as cleaners and security officers primarily. And then this membership is made up of primarily Latinx, African American, and immigrant communities. Next slide, please. So most of the private buildings or office spaces in Santa Clara County do subcontract to private cleaning companies and security service companies. There is a dynamic where there's also a building manager or sometimes a property management firm they're the ones that are in charge of establishing frequency of cleaning, as well as what are the security needs for that particular building or workspace or campus. The building managers are also the ones right now tasked with establishing what are those protocols for reentry to the workspaces, the social distancing guidelines, and security that's going to be needed to enforce this. And so the dynamic here or the tension, what we want to be aware of and really be able to influence is that frequently what we see in terms of the business dynamic in this relationship is that there is a financial incentive for building owners and or the property managers that manage these buildings to cut corners, right? Just for business sense. And so we need to really keep this in account as we're thinking about the public health aspect of how we're reopening office spaces. Next slide, please. So in terms of what we have been having a lot of conversations with the the contractors that are union that we partner with in the industry, both security and janitorial. Also, we have been having conversations with our members in both industries, as well as with some key what we call clients, which are building owners that have large portfolios, around how they're thinking about a reopening of the economy and reentry to these workspaces, as well as engaging Cal OSHA and other labor occupational health agencies out of UC Berkeley as well, in terms of taking into account worker safety. So we really want to make sure that there's proper training around the PPEs, that they have all of the workers have the PPEs that they need in order to work safely and risk contamination, that there is paid quarantine time available, as well as hazard pay and proactive notification when there's infection, which we've already been dealing with since the start of the shelter in home and the outbreak of the pandemic. The other thing to keep into account is the disinfection regulations and frequency of disinfection that's going to be needed. What are those protocols that are going to include?
Yeah,
Hello?
thank you, Denise. I was pretty strict with everybody about 3 minutes, and so great job, and we really appreciate it.
Absolutely. Thank you.
Thank you. Let me go to my colleagues and see if there are any comments or questions about any of the panels that you'd like to ask now. And if I don't see any, so what I'm going to do is I'm going to thank the panel very much, all the panelists that were with us this morning. We're going to take a break till 12:25. We will reconvene at 12:25. And again, I want to thank everybody very much. This was very, very informative. Your information will all be conveyed to our county departments that it's relevant to, along with any of the other recommendations you made will go to the appropriate level of government.
Supervisor Chavez?
Yes, sir.
Excuse the interruption. I thought earlier you had said we would reconvene at 12:15. Just now you said 12:25. I just wanted to make sure I was tracking the correct time to return to our meeting.
Yeah, 12:25. And the reason for that is we asked each panel to be here 30 minutes prior to their panel.
Thank you very much. Just wanted to make sure I was in the right place at the right time.
And yes, Mr. Wasserman, they're not all available right now. So that's why we're going to take the break the way we are, and we're going to give the clerks a little break. So again, I want to thank everyone very much, and I will see you all at 12:25. Those of you who can join us. Otherwise, go forth and change the world. Thank you, everybody.
Thank you.
Thank you.
I'm going to start welcoming back my colleagues. Get everybody.
Hi, Madam President.
Hello. Thank you for joining us, Mr. Mike, and keeping me on task. Really appreciate it. We need to do roll call again, and so once they, I'll just ask the staff if they have started to transmit again.
Are you asking if we are recording, if we are live?
If we're live, yes.
I can check. Just one moment.
Thank you.
Yes, we are live.
Great. And since we're reconvening, I'd like to do a roll call vote.
Supervisor Ellenberg?
Here.
Supervisor Simidian?
Simidian present, thank you.
Supervisor Cortese?
Here.
Vice President Wasserman?
Here.
President Chavez?
Here.
Thank you. We have a quorum.
Excellent. And I'm just going to, as our panelists get prepared for this next panel, this panel is focused on safe operations of retail and restaurants. And what I wanted to let the panelists know is that we have a clock up in the corner that will start your 3 minutes so that you know that your time has begun. And the clerk, for your slides, when you'd like slides moved, if you could let the clerk know, they'll then be able to move the slide for your presentation. Lastly, I do just to remind the public that we will have public comment on this item after this panel and prior to a final discussion by the board. And then there will be public comment from anybody who would like to speak to an item that is not on the agenda, but within the purview of the Board of Supervisors. With that, let me just begin by saying that this is now our fourth panel for today. I want to very much thank all the panelists who came before. And just as a couple of reminders for our panel, that if you didn't have a chance to join us earlier today, the first 30 minutes are pretty important, I think, for any business or community member to take a look at. And the reason is it explains very well the way that the county is approaching and developing health orders. So I would just want to recommend that to you and to the public. And then the other thing I'll say is we're asking only the panelists who are presenting to turn on their screens, and that way you have a chance to see the clock, and it'll be positioned in a way that's easy for you to see. And it just went off. It was on, but that clock just went off. So this next panel, I'm going to introduce and see who is here from these panels. Michael Romstad, the Executive Vice President for Simon Management, Stan Vukovic, CEO of KMB Hogue, Sue Newsom, Senior Shopping Center Manager at Valley Fair, Randy Musterer, Founder and CEO of Sushi Confidential, Dan Pham, Owner, Original Gravity, Paper Plane, Mini Boss, Supergood Kitchen, Kathleen Foley Hughes, Executive Director of Ada's Cafe, Ashley Yang, Director of Corporate Services for Din Tao Fung, and Fran Beaudoux, owner, Old City Hall Restaurant. And I am quite certain I harmed some of your names in that, and I apologize for that. We're going to be asking, if I could, just to make sure, if all of the panelists who are here, if you could turn your screens on for me, your video on would be great. And I hear a little human in the background, which is awesome. So we'll just, great, Sue. Let me see if I have Michael.
Hi.
Welcome. So I think I'm looking to see if we have Michael. So what I'm going to go ahead and do is we'll start the panel, and then we'll go back to folks that we missed. We'll catch them at the end, if that's okay. I'm going to ask folks to be on mute until I've called your name, and then have you present. You'll see the clock at 3 minutes. We're going to have the whole panel present and put it up to the board for questions. If anybody, if that's all right with everybody. And then I'm going to ask the clerk, if you could make me a co-host, please. So I hope that happened.
You should have received notification you are a co-host.
Great, thank you. I'm now going to we'll begin our panel, and Michael has not yet joined us, so we'll start with Stan Vukovic, the CEO of KMB Hogue. Welcome.
Hi, Cindy, thank you. KPM Hogue is a contract office furniture dealer headquartered in downtown San Jose with locations in San Francisco and Sacramento. We work with private and public entities, including Santa Clara County. We've been developing re-entry plans for our clients across multiple geographies and industries, as well as our own plans. Last week, we successfully reopened in our Sacramento location and are preparing to reopen San Jose when the county allows us to do so. Today, I want to share some of our plans for re-entry to our San Jose headquarters. Next slide. Our policy has been to adhere strictly to county guidelines in each location and meet or exceed all CDC protocols for health and safety. We're allowing, returning to the office to be optional for our team members. Our process is really, the first step is to do a 6-foot diameter study of all of our current workspace to assess physical distancing. From there, we can look at reconfigurations, enhancements, screens, even shift recommendations to meet CDC social distancing guidelines. We've installed signage as visual reminders. For our collaborative furniture, we've developed a red circle scheme to eliminate seating locations without removing furniture. We've installed sanitization stations throughout our facility and provided path of travel and markers. Next slide. In this next slide, what we're going to show you here is that 6-foot diameter study. The blue is our first shift that comes in week 1, the odd numbered weeks. Green is our executive team that's there every time. If we can go to the next slide. And then our shift 2 is done in purple. And you'll notice where we put the red dots to eliminate those collaborative areas. Next slide. We're doing things like replacing our soap dispensers and trash cans with touchless, limiting the use of the kitchen, providing disposable butcher paper placemats for desks and tabletops, doubling up our janitorial service to twice a day, having people remove personal effects. Next slide will give you some images of the kinds of things that we're doing. You see the red dots and some of the signage. If you go to the next slide, you'll get a chance to see path of travel. And then we'll go to the next slide. Before entry into our suite, whether you're a guest or an employee, we have a questionnaire that you fill out. If we can go to the next slide after that, you'll get a chance to see that questionnaire, and it can be accessed from our intranet or from an app on your phone. We go to the next slide. You'll see that here I'm just saying that we've got workplace will still be a catalyst for organizational success and a key to economic recovery. And the thing that I really wanted to see us get from the county is the opportunity. I've asked for an opportunity to get office furniture dealers into workplace today, so that we can help clients prepare for reentry. It takes up to 8 weeks to make these changes, and we think it's critical that companies are ready to get back to work the day that is available from the county.
Thank you, Stan.
Thank you.
We're going to go to Sue Newsome from Valley Fair.
Hi, how are you?
Welcome.
Great. Well, first of all, thank you for allowing me this time to share with everybody how we plan to reopen Valley Fair. As many of you know, we opened our expansion on March 6th, only to have to close on March 16th because of COVID. So over the last several months, we've really been trying to get the center up and ready for another reopening. And really our priority is to ensure that, again, we are promoting shopping, right? And we're promoting the economy and getting to a better place. However, doing it in a way that is safe for all of our employees, all of our retailers, and all of our customers. So that's first and foremost. So you could probably go 2 slides. So the first thing that I wanted to share is we have a capacity plan, and it's really built on our square footage that we currently have today, in addition to what the guidelines are for how many people are allowed to be in the center at any given time. And based on our square footage and our traffic from 2019, we have more than enough space for customers to shop as well as employees. We are also working very closely with our retailers to determine how many people they are allowed to have in their building as well, both employees and customers. We are also providing them window decals with a occupancy on it, so they are able to tell their customers how many people they could have in there. That way they're able to monitor that. You could go to the next slide. What we have also done is really looked at our common area. So based on this map, you could see our common area corridors actually are wide enough for us to have 2 individuals, in the area at any one time. I will show you in the next slides coming up is how we are going to do that. But we have removed soft seating, we have moved carts within our common area in order to ensure that we could have the 6 feet distancing that we need. This is an example of our back of house corridor. So it's not just about our common area and where our customers will be. It's also imperative that our employees and vendors have safe traffic flow. So you can see in this one, it's the back corridor. We will allow back hallways that way. The next photo you can see is our common area. And what we have done in this area is you could see the green arrows. That shows the different flow of traffic that we will have within our common area corridors. And then the slide all the way, or the picture all the way to the right, shows how we're working with our retailers to get actual queuing outside of their stores. I'm going to go quickly because I want one really important thing at the end. So quick, if you pass through these slides. This just shows sanitization stations we will have strategically placed throughout the center as well at every entrance. And then if you keep going, these are just additional pictures of how we will be setting up the mall. These are the photos we're using. Go on. Escalator and elevators, and again, really supporting the 2 feet or 6 feet of social distancing. This is what I really want to get to. This is helping our retailers be able to do what's called Yep.
You're breaking up quite a lot. And what I want to do is I want to give you a chance to find another spot in your room to come back, because I'm going to, as part of the questions, I'm going to have you respond to this opportunity. Okay.
Okay, great. I'll probably call in from a line because it must be bad in my, thank you.
Thanks. And so we'll come back to that the end of that. Randy from Sushi Confidential, is Randy on? If not, Randy, if not, may I go back to Michael, because I see you, Michael, and we'll give you a chance to present.
Yes, I was on, but I was having video problems.
No problem. We're going to muddle through this together today. So they're going to get to your slide deck, and so go ahead and start.
Yeah, I'll start. I'm going to give a different perspective. So, so far we've opened 151 centers so far across the country, and 16 in California. So the protocols that we put together, we have a lot of real world practical experience with it. We also, because the company has a global perspective, we have centers in Europe, Asia, all over the world. And so we've been able to kind of learn from their protocols as we developed ours. I think essentially, we worked with an epidemiologist and industrial hygienist to kind of help develop these protocols, focusing on 4 main areas. Number 1, employee wellness checks. When they come into work, all employees are temperature tested. There's a series of questions that are asked that are related to COVID or flu-like symptoms. If they answer affirmative, they're not able to report to work that day and must seek medical attention. So we start at the front line from that standpoint to make sure employees are safe, and also that the social distancing is followed in workplace settings and things of that nature. We have focused on cleaning and sanitation throughout the shopping center, a heavy focus after hours, and then adding additional personnel during operating hours to hit all the high touch point areas within the shopping center continually to keep the center clean and sanitized. We have a heavy focus on social distancing, both protocols we put in place and messaging to the consumer as well. So like Valley Fair, you'll see throughout the shopping center, different decals on the floors at any type of a waiting queue, in front of directories, in front of restrooms, outside tenant spaces, if they're not able to, because of capacity restrictions, take customers in their space. We're helping them out and creating space within a common area at the appropriate distances. Removed all common area seating within the shopping center that could be removed, blocked off others to make sure that we're getting those distances. Have not opened play areas, shut down public water fountains, things of that nature. So what we're seeing as a company is that customers and consumers are following these guidelines. They're being very conscientious of it. And so we're not seeing an issue there. I think, and most importantly as well, it takes a while for these retailers to ramp up. Once they're able to open, we're typically seeing about a 30% occupancy for a shopping center opening up, which means we're easily able to make any type of occupancy restrictions, and then we see that occupancy grow over time as retailers are able to bring back the employees they furloughed. So I guess the bottom line is we've opened up 151 safely across the country. We're very confident that we can do the same with the 4 remaining we have in California.
Excellent. Thank you for joining us, Michael.
You're welcome.
We're going to hear from the rest of our panel, then we'll go back to the board. And I know 3 minutes goes quickly, but part of the reason we're doing that is we want to get as much information as we can out. As we go to our next panel, this is Randy from Sushi Confidential. I also just wanted to remind my colleagues and all of you that all of your slides and all of the surveys you gave us are going to IEM. IEM is culling through those. We'll get to the county, what the county's information is needed, and then to other levels of government, the appropriate information that you're sending us for them as well. All right, so Randy, take it away.
Yeah, can you hear me?
We can, thank you.
Okay. Perfect, thank you very much for having me. My name's Randy Muster. I'm the founder and CEO of Sushi Confidential. We have 2 locations, one in downtown Campbell, one in downtown San Jose. I also have background prior to opening up a restaurant. I did cancer research as a research scientist for 17 years, along with working with infectious diseases, namely the flu vaccine. So when this all happened, it was easy for me to pivot quickly to understand, even before the health department told us what to do, and how to protect our employees, developing barriers. Our Campbell location, we kept open the entire time. We never shut down. We did to-go, delivery, DoorDash, takeout, but we never allowed any of our guests to come inside the restaurant. I didn't want, I had to assume every single customer that came up to, quote unquote, our patio window, that they had the COVID virus. So I just had to train our staff on the proper ways of disinfecting, assuming everyone had the virus. So that pivot was very easy for me. It was basically just teaching our staff. Over time, we've had the health department obviously get involved with additional things that we now follow, making sure we do temperature checks, keeping very accurate records on that. Additional disinfection, creating your plexiglass barriers. And a lot of it is mainly just educating our customers, DoorDash customers, our normal sushi customers, just making sure that they're aware what the 6-foot distancing means, because at the beginning, a lot of people just didn't really believe in that or didn't even understand that. We developed a very good to-go success model out of our Campbell location over the last month and a half. And now we've now transitioned to do the same thing in our San Jose patio. However, now that had to get shut down because of all the riots that were in San Jose. At the same time, we find out from the health department that we're able to now open up patios. So now we're scrambling again to institute all the new rules and regulations to be able to open up our patio space, which is about 4,000 square feet. I think some of the immediate needs we need is a Spanish version of the health department protocol. We have some Spanish speaking individuals here, so we're kind of doing our own translations. Having some more defined type of requirements from the health department. We're seeing a lot of different things that other counties, cities, or states are doing, and it's just difficult for us to know what's acceptable and what's not.
Randy, thank you very much. And thank you for sharing your different experiences as well. We really appreciate it. Scientist chef, that's awesome. All right. We're going to move on then to Dan Pham. And Dan, you have a lot of restaurants, so you're going to have some perspective. Welcome.
Hello, thank you for having me here today. Over the last 10 years, my partners and I have grown a small 1,000 square foot restaurant to a group of 4 restaurants in the downtown core, employing over 100 employees. Before COVID, we operated these businesses 360 out of 365 days a year since we opened 8 years ago. And since shelter in place was enacted, we've had our doors shuttered now for, I think, 82 consecutive days. We furloughed 90% of our staff, and we've now pivoted to a completely new business model to begin the process of rebuilding and sustaining our business operations. Kind of what we've been doing, we've been operating a small to-go program according to county and CDC guidelines. We've been renting out kitchen space to other food trucks that don't have the space to operate through these guidelines. We've been providing weekly grocery kits and meals to our former employees who have been most severely impacted by the shutdown. And we've been making preparations to reopen our space, adhering to the local and federal government guidelines for both Santa Clara County and the CDC to prevent the spread of COVID. And we also have been trying to secure as much capital as we can via federal loan programs and other programs available to us. And with our current operations, we're only seeing about 15% of our original business. And our goal is to basically survive for the next 12 months until things are able to return to normal. And unfortunately, we don't see a situation where we can kind of keep our whole staff right now. And there's going to be huge cuts in terms of jobs to this industry. And only when the virus is deemed controllable by vaccine, general immunity, or therapeutic treatments can we really begin to rebuild what we thought of as normal. Just to go through these slides real quick, some of the challenges we're facing: a lot of work from home now, so there's a shrinking workforce in downtown. There's no conventions, tourism, or business travel. And I'll skip through this so I can kind of focus on what we're kind of looking to from the county here. So what we need to see, I guess, from the Department of Environmental Health, maybe expedited approval, targeted COVID alteration approvals, meaning, create low or no cost same day permit processes for improvements to existing facilities for the purposes of safety and business survival. Things like to-go windows, awnings, sidewalk improvements, counters, hand wash stations, occupancy changes, etc. Support multi-use of space. We've had a kind of shift to a production facility in some of our restaurants to sell, to-go cocktails and food and everything we can do to kind of survive. And also providing guidelines on safe operations for us. Can we provide clear and coordinated and specific set of guidelines on how restaurants can operate in the pre-vaccine period? And also provide criteria for creating safe work environments for employees and safe interactions between servers and the public. And then also, getting rent relief for these tenants. Is the county able to incentivize landlords to subsidize restaurants and small business tenants' rent? Can you provide property owners direct tax reductions based on their documented rent subsidy to their commercial restaurant and small business tenants? We know that we can't just ask for not paying rent. We know that they have to get breaks on their levels as well. So having that there's a whole system of folks that are kind of affected by this. And, it's going to take a lot of different things to kind of help us out. So I just wanted to focus on kind of the overarching problems we're facing rather than kind of specific things we're doing right now to deal with the issues.
Thank you very much, Dan. And we got your slide deck. It's actually really good. Thank you. I'm going to move now to Kathleen Foley-Hughes from Ada's Cafe. Is Kathleen with us?
Yes. Hi. Can you hear me?
Yes, we can. Thank you.
Thank
thank you so much to the county and President Chavez for bringing us all together to share best practices. I've learned so much already. Ada's Cafe is a nonprofit social enterprise that hires adults with a variety of disabilities and other marginalized community members. We have a cafe in Palo Alto, a commercial commissary kitchen in Mountain View, and we've grown to become, a real community gathering. Next slide. Ada's closed before the shelter-in-place orders out of significant concern for our employees, many of whom have underlying medical conditions. And we reopened in early May for takeout meals that are placed into the trunks of people's cars, and people pre-order those. So that's worked out pretty well so far. Next slide. Our plan is to reopen our patio only next weekend. We will see how that goes. As I had said, we've been a community meeting space, so it will be interesting to see how social distancing will enable us to be viable. We'll continue to do our takeout meals that people pre-order, so hopefully that will give us an ability to be sustainable. Next slide. So in order for us to operate safely for our employees, have plans and protocols in place to keep everyone safe and healthy. We've been following the guidelines that the county has published and the CDC. So we feel like we are ready and getting ready, certainly to be able to interface with the public. Anyway, next slide. And when we reopen our patio, in order to keep the community safe, we'll require our customers to wear face masks, and people in Palo Alto tend to, follow the rules. So we've already seen that, and we will provide hand sanitizer, paper menus, for food, all on compostable or disposable serveware. And we will clean and sanitize eating spaces as, when people come and go. That's part of it. Next slide. Cleanliness and sanitizing have always been a high priority for ADA's. Santa Clara County is very strict, and we follow those guidelines, always have. So, and we have new protocols in place for cleaning and sanitizing in order to keep the community and, again, our employees safe. Next slide.
Kathleen, I'm going to ask if you could wrap up with this. Your time is up. I was hoping you could go to your last slide about what you need.
Sure. You can switch to that. So I think we could use help with all of these things. I think multilingual signage. We have a very diverse population in Palo Alto. It would be great to have that. Again, having help from the county health department about reviewing our physical setup and protocols would be helpful. And anyway, thank you so much.
Thank you for joining us. Don't go away. We may have questions for you. May I go to Ashley Yang?
Hi everyone. My name is Ashley Yang. I'm presenting on behalf of DinTech from USA. We want to start by thanking you for giving us the opportunity to participate in this conversation. We wanted to share a quick high-level summary of some of the changes we've implemented. We have had the opportunity to open up one of our locations in San Diego in Southern California for in-room dining, and also up in Portland, Oregon. So as we prepare to reopen our other stores, this is what we're using. So next slide, please. So first, we're promoting social distancing. We have reconfigured our dining rooms and updated floor plans to meet social distancing requirements. So firstly, we're maintaining 6 feet of distance between guests by rearranging tables and using floor decals. We're also operating as a reservation only during this time, with a maximum party of 6 in California, 5 in Oregon, and 5 in Washington State. We're also adding plexiglass barriers at the takeout and host stand areas and promoting contactless pickup and delivery options across all locations. Next slide, please. We've also reevaluated our steps of service to reduce contact. So we've changed many of our internal procedures. These are some of the most noteworthy. We have converted to fully cashless, and we also have contactless payment available on every check. We've also offered digital dining menus instead of physical menus to every table. And we've also placed plate covers on all food that leaves the kitchen to prevent cross-contamination, and packaged all of our condiments that used to be in shared containers to single-use disposable packets. Next slide, please. We have also made significant changes to our facilities and upgraded our cleaning products because we really do understand that our first priority during this time is to prioritize our guest and team members' safety. So we have worked with MarkSafe to become a MarkSafe certified facility. MarkSafe is an EPA approved, NSF certified company that uses hospital grade disinfectants to clean the facility. So we have become MarkSafe certified at all of our US locations. In addition, we have upgraded all of our cleaning products to be CDC and EPA approved as effective against COVID-19. This includes peroxide-based products and 70% isopropyl alcohol or 60% ethanol-based cleaning products and sanitizers. Additionally, we have also increased our frequency of disinfecting high touch point surfaces to 30 minutes or after every use, whichever is more frequent. And we've also upgraded all of our air filters within our facilities to MERV 13. Next slide, please. We have also been very vigilant with the way that we handle PPE during this time. We require all team members to wear PPE. This includes face masks for all team members, single-use disposable gloves for all team members, and making sure that these are changed in line with health department guidelines and are not used in lieu of hand washing. Also requiring face shields for all of our dishwashers. And in LA County, we do require all of our front of house service staff and managers to wear face shields when they're interacting with guests who do not have their face covers on during their meals. Additionally, we require team members to clean and disinfect their uniforms daily. And last slide, please.
Oh, this is your last, you're a little over time. Do you mind being brief on this one?
Yes, of course. So across the board, we've been screening and educating our team members, screening daily, preparing comprehensive contact tracing protocols for positive cases, and requiring several required courses to educate our team.
Thank you, Ashley.
Thank you.
And our last speaker on this panel is Fran. Fran, and I hope I said your name properly, Boudreau. Is Fran with us?
Okay, I unmuted. Can you hear me now?
Welcome.
Welcome. And it is Bodette, but thank you. It's typically pronounced incorrectly. Anyway, I'm the owner. My husband and I own Old City Hall Restaurant in Gilroy. We've owned it for going on our 9th year now. My background is with fast food, Carl's Jr. Restaurants. I've been with them for 47 years. And so I have a lot of background in restaurant, and I've never in my years of working in food have seen anything like this. So this was a real eye-awakening, alarming situation. Our building in Gilroy is about 12,000 square feet. We're a typical mom and pop. Currently, we're running about 1,500 square feet. Today, we got to open our patio, and we can seat approximately 60 people on the patio, providing social distancing is met. And we've moved a few tables around to be able to adhere to that. We've been following the County Department of Environmental Health for Santa Clara County, following their supplementary measures for outdoor dining. Basically, dining's limited just to the outdoor area. They may only enter in indoor areas to go out to the patio. So we've had to close off. We have actually gates on our patio that go out to the street. So we can't legally lock those, but we do have signs posted that say, please use the front entrance so that we have control of our traffic coming through. We've added an additional 5 sanitizer stations throughout the restaurant. again, we have an upstairs dining area, banquet area that seats about 150 people, which we haven't used in the last 3 months. And then the patio, like I said, currently we're seating 60, and our indoor dining room sat about 85. So we're down quite a bit on space wise and what we've been able to do over the last 3 months. We've posted all the required signage for social distancing for our employees, for people that come in to deliver products. We are limiting our tables to no more than 6. And that's a little difficult because a lot of people, it's graduation today. And so a lot of people have 10 and 12s and it's like, no, I'm sorry, I can't take you. And I see the clock is running. We are limiting our time on our patio to an hour and a half. We are still offering takeaway, which we've been running about 45 to 50% of our prior year over the last 2 months by doing buy one, get one free offers, doing some gift card offers. And actually tomorrow we're doing a virtual fundraiser for Operation Freedom Paws, which is a nonprofit organization. And we're basically adhering to all the Santa Clara County health requirements. And I see my clock is out. Thank you for having me.
Fran, I'm so glad. Fran Bodette, thank you. So what I'd like to do is go to my colleagues and see if there are any questions. And I'm going to just see if anybody has a raised hand. And then no, Susan? Okay, thank you.
I don't have a question for these panelists. I just have a process question about the appropriate time to make general comments about the program today.
So what we're going to do is we'll address this panel, and then we're going to go to item G on your agenda, which is a discussion about possible recommendations or next steps. So that's where I would say it goes.
Thank you.
Any comments for this panel? If not, what I actually wanted to do is I do have a few questions. I wanted to go to Sue, and Sue, could you talk about the tool that you're using, the app you all are launching or have already launched? You're on mute, so let me see if that. There you go.
Okay, let's see. All right, so yes, so we're really excited. We're actually starting to launch it in our centers that have already opened next week. And basically what it is we have a app that's URW Connect, which is the way that we communicate with all of our retailers today. So what we are doing, and again, free to charge to our retailers, is there is a way on the app that they would work with their customer to do a wait list. So let's say I want to go shopping and I don't want to wait in line because I don't want to, be around others. They would then text me and say, it's your turn now in line. You could come to the store. So I could be waiting in my car. I could be somewhere else, in the mall shopping. But I would get a text message saying it was my time to come. That's one. The second function would be if we just do for reservation. So let's say Louis Vuitton wants to do reservation only. So it could be that I make an appointment with Louis Vuitton for 11 o'clock on Thursday. I would do it through this app. So then again, it's 11 o'clock. I go to Louis Vuitton. It's my time in the store with a employee to help me at that time. So we are doing, and what we will do, Cindy, is every retailer that wants to be on this, we do training with them. So we will teach them and train them how to use this app. So it's very easy for them and for our customers. But we really feel like it's a great way to, again, promote shopping and the economy in conjunction with, really people social distancing and people not having to be waiting in line around others.
Thank you so much. I really appreciate it. I thought that was the coolest thing when I saw it. So I wanted to make sure you got a chance to share that. I want to go back to KB
Am I frozen again?
No, you're good. Thank you. I'd like to go to Stan for a minute for KBM. And Stan, what I was curious if you could talk just for a minute about how, like, what are clients requesting of you as they're getting ready to go back to work? So what do they want you to do for them as they're starting to go back and get their employees back?
There's really two things. There's a short-term plan to get your employees back to the office safely. And then there's long-term planning where we think, planning for office and workplace is going to change fundamentally, and it really depends on sort of, leases and real estate, how long, how soon they approach that long-term planning. We start those plans and we look to see where overlaps are. And then we put a general plan together. If they don't have room with their existing space to bring everybody back, then we're putting shifts together for them and showing them how to do that. We're going into collaborative areas and figuring out how many people can you bring into a conference room or at a off seating setting. And we're trying to help them develop plans around that. We're finding most of the people are going to want to come back to work. That the majority of folks, even though work from home has been touted, are going to come back to the office. And so what we're trying to do is help them make that easier and more comfortable. So some of the things that we're doing once we've figured out the planning is we're reconfiguring furniture. Some cases with furniture systems, you can rotate desks away from each other. In other cases, we're going to a panel and adding another section, or we're adding glass or marker board, or you name it. There's all kinds of materials that have, bleach cleanable. There's a lot of materiality that can change, that can be adjusted. Freestanding screens, desktop, lots of acrylic. There's acrylic's the most popular material in the world today. And then we're doing soft architecture solutions for some of our clients where instead of having one big open plan, you might have, plans that have 6 or 8 people, and we're using something other than a constructed wall, some kind of a furniture solution to divide space. So those are the kinds of things, and it involves getting out, ordering furniture, getting out there into the workplace, doing, verifying as-built and doing reconfiguration work. So there's really a lot of work to do to get ready for reentry.
Thank you. I appreciate that very much. I see that Supervisor Cortese has his hand up. Let me go to you, Dave.
Thank you, President Chavez. I think the person I want to ask this question to is Dan Fan, if he's still on. Looks like he might be, just because he's dealing with a variety of sort of physical situations, having multiple downtown establishments, and also he talked about, first of all, I appreciate everyone's candor, including Dan's, and talking about what we are and not going to be able to do from an expectation standpoint. I kind of appreciate hearing the folks who are struggling, whose employees are struggling, but at the same time understand that, this isn't make believe, and it's a biological issue that's out there that hasn't been figured out yet. So the idea of changing or adjusting business model, knowing how hard that is still, in some sense, kind of paradoxically refreshing to hear that, hey, we're trying to figure out how to do this. One of the issues I brought up recently at one of our board meetings when none of you were around was what I call an equity overlay. And a lot of times when people hear that, I think, they're thinking more in terms of racial or ethnic equity. And certainly that's a huge issue right now with the pandemic and in many other ways, as we all know. But there's also the equity of how we treat people who are similarly situated, but not precisely situated the same way. And of all things, it strikes me that the outdoor dining requirement is one of those things where it's a one-size-fits-all approach in some sense that doesn't really take basic fairness and equity into play. But I may be overstating that, and I'm wondering whether it's your own experience with your own shops, or whether you've seen it with folks with competitors, with others in the community. But it strikes me that one location has a patio, or outdoor space easily available to it, and another doesn't. And they could be right across the street from each other on the same corner or on the same destination location, in an urban setting like San Fernando Street. I used to commonly, when I was on the city council, have a cup of coffee in front of a cafe that could at most put one table and chair, set of chairs out in front, and 6 or 7 inside. How does that work when, a half a block up the street, somebody's got all kinds of space and they can just open wide open. I understand, we understand we're dealing with a health crisis and we're not trying to be first and foremost economically equitable, but I've been arguing as we assess the risks that maybe we need to look at those kind of equities and how do we balance them. Do you have any thoughts on how real that issue is, Dan? And by all means, if it's not a big issue, please say so. That works too.
I'm happy to respond. You bring up some good points, and just to kind of shed some light on things now, we have one business that's on the corner of Santa Clara and 2nd Street. We've had demonstrations all week since last Friday happening. We've actually had a couple windows shattered. Luckily, our staff was actually operating to go that day, and we were able to kind of come outside and defend our property and tell the looters, hey, please don't destroy our property. And, we support the protests and things like that. But, today, for instance, we have the option of opening outdoor dining, and we chose not to just because the climate downtown, our patrons wouldn't feel safe. There's social issues to deal with. There's economic issues to deal with. There's a whole lot of things we're kind of working through. And for a business the size of ours, we were dependent on things like the EIDL loan, which was going to help us kind of bridge the gap for at least 6 months. There was supposed to be $2 million available to kind of get us through these next couple of months, but that was capped at $150,000 now, which maybe will get us towards the end of August if we're lucky, if we spend the money right. So there's a lot of different challenges we're facing, and with the size of restaurants that we operate, we're pretty successful in downtown. We have great regulars. We do really well, but we also operate on margins that are somewhere between 5 to 10%. And for us to kind of shift everything down to basically the faucet has now turned into a drip, and all of our fixed costs have remained the same. So it's going to be a challenge trying to balance that out, and it's going to take maybe a year or who knows. And right now, even if like a second wave of the pandemic hits, we really don't know what we're going to do. But we're going to do everything we can. There was a lot of good information here on how people are preparing for how to interact with the public, but the reality is that the economy is going to take a huge hit from it. And I would guess that you're going to see anywhere up to like 50% of restaurants not survive this.
Right. Well, obviously the industry has a tough survival rate as it is. If you make it past 3 years, you're entitled to a blue ribbon.
Exactly. Yeah.
As a business manager, I believe I used to be in the business myself years ago, and you could rarely afford to have more than 2 slow days a week just to break even. If you had lucky enough to have 6 out of 7 good days a week, you could actually make 5 or 10%. But my question fundamentally is, what would you advise the public health department, if anything, in terms of dealing with the disparity between those who actually have outdoor space available versus those that don't? I mean, is there anything on your mind? And if not, that's okay. It may be an impossible not to untangle, but I'm just wondering if you think there's a way to deal equitably with that situation.
We're all for supporting, the county health and stopping the spread of the disease and, following these things as close as possible. And, if the issue right now is contact tracing, and then, educate us on how we can become good contact tracers. We interact with people on an everyday basis. We can set up guidelines, give us some tools, and, we're going to space everybody out. And, we're willing to do what we need to do to open. We're pretty resilient. We can shift gears quickly, and we have to. So, if, the hospital numbers seem low, but if we're not confident in tracing and those other things, how can we get to that point? And right now we're just kind of watching closely all around the world with, you know, partners and friends that have opened businesses and how things are going, whether there's spikes, and just kind of being reactive and also being prepared for anything, you know.
Thank you, and thank you all for your testimony today. Thank you.
Dave, this is Sue from Valley Fair. I just want to talk about that a little bit, because one of the things that we're facing when we do open, our restaurants that we currently have that have dine-in, none of them have outdoor dining. So Cheesecake Factory, Din Tai Fung, California Pizza Kitchen, those are our only restaurants. None of them have exterior dining. So we're facing the challenge of, you know, across the street, Santana Row, obviously there's a lot of outdoor dining. So some things that I don't know exactly what we could do maybe from a, you know, a city county standpoint is, can we look at some kind of permitting that would maybe allow for us to have, let's just say for argument's sake, Cheesecake Factory out on our new plaza, you know, where they could potentially do dining and create their, you know, their restaurant outside and not still bring people inside. So I think there's some maybe different things we can look at depending on how long we're considering it only being outside dining that perhaps could help.
I also want to mention a couple of
Yeah, and I'm sorry, Dan, if Randy can jump in. Randy, you're on mute, and then I'll come back to you, Dan. There you go.
All right, thank you. So our downtown Campbell location, on Tuesday, the city council put together a resolution to open up outdoor dining space on private property. So if any restaurants currently, whether they do or do not have patio space, they would be able to encroach on private property, you know, in a parking lot and take up some parking stalls. The next day, and that can be done immediately. So today, everyone's trying to open up whatever private property they have in Campbell. So that was the immediate relief for those people that didn't have the ability to have a patio. So maybe that can work at some of these malls. And then now the city council, the next phase would be how to utilize some public parking or public space, but that takes a little bit more, you know, thinking and engagement before that they can do that. So that was an instant relief from the Campbell City Council.
Thank you, Randy. Go ahead, Dan.
I just wanted to mention that, you know, something we've seen from the State Department that has been really helpful and who has moved quickly was the ABC. They kind of pivoted very quickly in allowing kind of loosening restrictions on allowing to go for alcohol, allowing kind of our, you know, they're very restrictive on the space where you can serve. And then they put out some guidelines from our local office saying that, you know, if there's public space that is adjacent to your business that you're able to kind of supervise, like it was kind of like an at-will thing that automatically was approved based on your license. So kind of just doing things that make it easier for businesses to kind of reopen or pivot quickly. You know, we've had developers that own private land around us, you know, talk about creating public spaces. Urban community has been really helpful in the downtown area with kind of like, you know, lending a hand to the neighborhood in order to kind of open up these streets and allow us to kind of pivot to a new model in the next coming months.
Thank you, President Chavez. I just wanted to say, and
You have one more respondent, Dave. Ashley Yang wanted to weigh in on to your question.
Hi, this is Ashley from Din Tai Fung. We wanted to share a little bit about this because it's something that we've been facing down at one of our LA locations where we do have our restaurant right next to the curb, and we have been provided the option potentially by the city to extend our dining to take that curbside. And one of the difficulties that we have as a sit-down restaurant is that 50% of our seats are booths that cannot be moved. And then our tables themselves are quite high quality, so they don't move out well, and once they're there, they don't do well in the sun. And so it would definitely be a very different environment. Also, we've equipped our facilities to have a lot of these air filtration systems and cleaning technologies to make them safer for our team members and our guests. And a lot of that would be lost by moving outdoors. I think what would be really helpful for us from this perspective would be to have that flexibility where if we do allow outdoor dining, and that works for certain restaurant concepts, that would be great. But for those that maybe can meet other requirements like PPE requirements or being fully reservation only and therefore being able to fully contact trace, which all of our restaurants are, then maybe allowing in room. Because currently for all of our restaurants that are opening, we are limiting party size, have full PPE, and are 100% reservation only. So every time with every party, we can contact trace.
An excellent point, Ashley. Thanks for raising that. Dave, I'm sorry, I didn't mean to interrupt you.
No, I just wanted to do sort of the mini summary. I know you're taking copious notes and we're going to talk later, but it strikes me that I was earlier thinking of this issue as perhaps more of a land use issue for the cities. And I know that you and Supervisors Committee have been meeting with the mayors, so maybe that can continue to be a front burner issue. But also it strikes me now that our health department is going to have to be nimble and able to move quickly on these outdoor retrofits because there's a whole bunch of issues there that restaurant owners know about in terms of trying to serve food outdoors instead of indoors. And we need to be willing to invest internally in making sure we have enough health department staffing to do this. Now, lastly, the contact tracing, I think, is an intriguing offer. Two of the presenters, basically offered to step up in terms of contact tracing, in exchange for a little more latitude in terms of indoor dining. And maybe the public health official will consider that to be a worthwhile trade-off to look at, especially as desperate as we are for contact tracing. Thank you.
Thank you very much. I want to thank all the panelists. We have no more questions from my colleagues and really appreciate you being here. What we're going to do next is with 3G, we're going to go to public comment. So if there's anybody who would like to make a public comment on, not a public comment, I'm sorry, a comment on the panels that were before us, this would be the time to do that. And I'm going to call on or ask our clerk if they can call on the public speakers. And then for my colleagues, this is item 3G. We'll go back and discuss a little bit about what we learned, next steps, and what are the opportunities that are before us. So with that, we're going to give each public speaker 2 minutes, and as long as we stay under 10. Right now we have 3. Thank you.
The next speaker is Chris Simmons. I am unmuting you. You have 2 minutes to speak. The timer will start when you begin speaking.
Chris? Perhaps you can go to the other speakers and then we'll try Chris one more time.
Okay, we ready now?
Oh, go ahead, Chris.
Okay, great. Thank you, dear honorable supervisors. My name is Chris Patterson Simmons. I am the alternate co-chair with the Greater Downtown San Jose Economic Recovery Task Force. I'm also a business owner in downtown San Jose and would like to read an abbreviated version of the letter co-authored by my respective task force, the Silicon Valley Recovery Roundtable and the Health and Equity Task Force. It was also sent this morning to you all by Councilman Raul Perales. As a responsible elected body overseeing our public health department, we respectfully request that the Board of Supervisors direct the Public Health Department to meet our various task forces to explore collaborative policies and tactical solutions that would restore our economy and daily activities while continuing to protect the health and safety of our most valuable or vulnerable communities. We recognize and commend the successful efforts of the County Public Health Department led by Dr. Sarah Cody, as we saw a rapid increase of identified COVID-19 cases and unfortunate deaths. Dr. Cody swiftly brought forth a cohesive county-wide response. Thanks to her leadership, a region-wide public health order was put in place and resulted in countless lives being saved. Our nonprofit and business communities have stood in solidarity with the Public Health Department, making the painful decision of overhauling or even shutting down operations to keep our communities safe. And while locally we have averted a worst case public health crisis, our disadvantaged communities of color and small minority owned businesses have disproportionately affected by this pandemic. Critical conversations are occurring with great participation from community members and our local elected officials. However, in order to thoughtfully produce informed solutions and recommendations, it is vital that we also have the active participation of our county's health officials. We recognize that the new normal is inevitable, yet we believe that the policies that we shape that are normal should not be crafted in a public health vacuum, but rather with a consistent consultation and meaningful input of the industry, frontline community.
Scott?
The next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everybody. Scott Largent. These have been some interesting conversations to listen to. My main concern, some people might get offended by what I have to say, but this is a lot of the stuff that I deal with. Being poor, you know, I'm not completely poor, but I'm pretty poor. And I utilize some form of assistance, EBT, cash aid, things like that through our county. Santa Clara County is a pay-to-poop county. So unless you can spend money at a restaurant, you can't utilize their bathroom. Now, I don't, on these panels, I think it would have been great if we invited maybe a representative from 7-Eleven. Now, 7-Eleven, hundreds of millions of dollars are spent with food stamps and EBT, yet they don't have functioning restrooms for the public. So you cannot wash up if you grab a bite to eat, you go into the store. Now there's a little hand sanitizer thing you can squirt in your hands. Yesterday when I got off work and I am homeless, I went downtown. Okay, I really wanted to wash my hands. There's no running water in any of the parks right now. There's no restrooms that you can walk into. City Hall shut down. The libraries are shut down. County building by that time was shut down. With the riots right now and the issues of the protesting, you can't go to the bathroom at the sheriff's department. So there is no place to go. And all I wanted to do was just wash my hands. I was finally able to make it over to Home Depot. They had some functioning bathrooms right there. I just think these restaurants need to make it easier for people to use the restroom, wash up, stay clean. And as far as the mentally ill and homeless that are downtown and are utilizing EBT, give them a place to go eat. Set something up maybe at the county building outside the back of the cafeteria where we can utilize EBT and we don't need to frequent these businesses down there just to ask them to use the bathroom or water. I think the Downtown Business Association would love that right there. And let's use that little fish and kind of pull people out of there right now. Give them services, shower, place to go, Wi-Fi, internet, and then they won't clog up downtown. Because you guys want to use patio space right now in those.
The next speaker is Sherry Burns. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good morning. It's not Sherry, it's Christine Fitzgerald. Good to be here. I have several concerns when looking at, for example, trying to reopen schools, looking at either in-person learning versus virtual learning. For a lot of students with disabilities, these are large challenges to meet. How do you propose to address these issues along the way? Another series of issues that I am concerned with deal with sanitation in the sense that, for example, in restrooms, you are going to do a deep cleaning of the restrooms on an ongoing basis, which I truly appreciate. Please do not forget to wipe down the handrails, both the side and back rails. These are critical points of contact for folks as they have to utilize these rails to make a safe transfer. Same thing with going to wash your hand and utilize whatever soap dispenser and towel dispenser slash air humidifier to dry hands station are there. I certainly understand the need for outside areas for people to congregate, to have lunch in an open area. I will caution though, please remember that there should be space for people to walk by or roll by on the sidewalk safely. Thank you.
Thank you.
The next speaker is Matthew Quevedo. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Board President Chavez and Board of Supervisors. This is Matthew Quevedo, Director of Transportation, Housing, and Community Engagement at the Silicon Valley Leadership Group. First, I want to thank you all for providing this opportunity to allow our members and others to speak about what it is they're planning to do with their next steps as we move towards reopening the local economy. We've submitted a letter with a list of protocols for manufacturing and office space. Would love it if you all would get a chance to take a look at that when you have the time to do so. I just want to highlight a couple items that we found were most pressing with our members. The first is privacy issues around screening. Completely understand the need to track this illness as it makes its way through the county, but really wanted to emphasize the privacy issues around collection of names and private information. So that's available in the letter when you get a chance to look at that. Also, as you all know, the leadership group has been heavily involved in helping secure PPE here for the Valley Medical Center Foundation and other hospitals locally. Just want to point out, we're hoping that the county doesn't call for specific items to be purchased for PPE if there are alternatives. Just putting that out there since there's a limited stock of PPE available out there on the market right now. And then finally, just want to talk a little bit about the different orders coming from the different levels of government. A number of our members have had to hire full-time staff to keep track of the changes and the differences in the orders. So hoping that Santa Clara County can definitely be a leader in ensuring that there's clarity from these orders coming down the line. Thank you all again. Glad to see the public and private sectors partner in this way.
Thank you, Matt. John will be our last speaker on this item.
The next speaker is John. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
John? You may not know how to unmute.
Hello?
Oh, there you go. Welcome.
Yes, hello?
Hello, John.
Okay, can you hear me?
Yes, we can.
Okay, do I have to touch anything?
No, you're good. You can go ahead and talk.
Okay, I just want to say that the county of Dallas has, in Texas, has almost the same population that Santa Clara County has. They've had probably 3 times the number of virus cases that we've had. They've had twice as many deaths as we have. They are fully open. We are not. Okay, there's something wrong here. Okay, does it have something to do where they're all Republicans there? Here they're all Democrats. Something is not right here. Okay, because of the shutdown, people have lost their businesses. People have had their lives ruined. Okay, you are making old people wear masks in 100-degree temperatures. They're having respiratory problems. Okay, however, you do let people go out and riot and loot. Okay, so I ask that you put a stop to this. You reopen our economy. Okay, it's not a coincidence that states that are run by Republicans are open and states that are run by Democrats are still are negating and making it difficult to open. The hospitals were never full in this county from day one. Okay, I have friends that work in the medical field, family friends, and they attest to that. They're total lies. It was never any chaos. You currently have more than enough capacity if this virus resurfaces. We have never closed our economy before. We should never do this again. This should have never happened. please open up. You're smiling. I know you're smiling because this doesn't affect you because your salaries keep on coming in. Ours do not.
John, thank you for your testimony. So I'm going to now move to my board colleagues and see if there are any comments or questions in the overall with the overall day. And I'll just remind my colleagues that all of the reports that are being gathered will be collated by IEM, and then they'll go to our staff, maybe the public health department, it could be environmental health services, it could be a number of departments, and then on to cities and or the federal government for recommendations. So I will now go, I'll start with Dave and then I'll go back across. Thank you.
I'll keep my comments brief. First of all, thank you again to everyone who participated. Thank you, Supervisor Chavez, President Chavez, for the effort of you and your staff. And your staff did a lot of work to put this together, get the invitations out and panels built for this event. But I think it's exactly the kind of work that we need to keep doing. We've been doing, all the supervisors have been doing a lot of this on their own through their offices, meeting, dealing with constituent inquiries from different segments of society, businesses, faith communities, community-based agencies. And I think it's been productive. I think the people in our EOC have been grateful for that in our emergency operations and public health. And they've made good use of a lot of the information. I'm sure today will be no exception. It strikes me that going forward, we perhaps need to focus even more at taking advantage of the kind of offers that are out there from those who are most astute and clear thinkers, and we've heard many of those today about how to reduce risk or compensate for it by building in some of the very things that public health wants, but directly into the business. And I don't mean just PPEs, but talking about accelerating contact tracing and testing by virtue of partnerships with some of the businesses, for example. That's very intriguing to me. And then lastly, I would just say, it also strikes me that like so many other things in a big county with 22,000 employees and 40 departments and agencies, when you're moving this quickly, and we have been moving very quickly, management in this county has moved extraordinarily quickly. They have put together rules and legislation that would, in ordinary times, probably take 2 years to get through the legislature, and they're being done in 10 days or 2 weeks oftentimes. So people are moving quickly, but the disadvantage of moving quickly is oftentimes you don't cross-pollinate or cross-coordinate with departments and agencies internally. And I thought the restaurant example, where there was a lot of concern about, besides the health protocols, what can we do to, again, compensate a little bit by speeding up permitting? And for us, that would predominantly be the health department, except in the unincorporated areas. But what can we do to work with the cities who are more responsible for local permitting, to move quickly? That's not the kind of work the county was able to do the first 2, 3, 4 weeks of the pandemic, because it was all hands on deck, just trying to focus on triage and making sure we weren't overrun and overwhelmed. And obviously we still have people dying to this day. So as things hopefully stay flat, maybe there's an opportunity, and that's my point, to cross-coordinate a little bit more now, in terms of what we can do in terms of opening, especially on the business side, with helping to speed things up. That's all I have, President Chavez. Thank you again for the opportunity to participate as a full board. I thought it was a good idea.
Thank you. That was very helpful. Ms. Ellenberg?
Thank you. I want to add my thanks as well to all of today's panelists. I noticed that many of the businesses that we're representing today are from my district, so I want to particularly appreciate their active engagement. While today's been framed around reopening, and we are currently opening more sectors of our society, I think the two big questions are, First, how do we coordinate reopening across sectors? And second, how do we continue to remain open safely over the course of the pandemic? The grocery workers presentation included recommendations on temporary closures for cleaning upon identification of cases, notification of employees at sites, and access to paid leave for employees. These seem to me to be core policy issues that would be applicable across a variety of sectors. So one of my recommendations would be guidance from the public health officer on steps to be taken when or if cases are identified in various types of organizations or businesses. Similarly, several employees in the office spaces panel cited questions about contact tracing, and it's unclear to me whether they're considering in-house contact tracing capacities or integration and cooperation with county-led contact tracing efforts, which are currently in place and scaling. And again, these questions would apply across a variety of sectors. To the extent that there is willingness from these sectors to assign staff to the county-wide tracing effort, that would be welcome. But this broadly seems like an area of two-way communication going forward. Also, my second recommendation would be to create a guidance document for all employers on issues that they should be aware of relative to contact tracing, including what it is, why it's important, and how they can support tracing and isolation activities if they have an employee who tests positive. And also to review their leave policies and employment protections to allow cases or contacts to stay home when they are sick or exposed. What really struck me today is that the return to work, return to school, and childcare all need to fit together. So when we are considering schedules and modifications of one sector or another, we really need to ensure that everything is aligned in a way that makes sense in the lives of our families. So communication and coordination across the sectors really will be critical, and that's primarily what I wanted to emphasize today. Thanks so much.
Thank you very much, Susan. Supervisor Simidian?
Thank you, Madam President. I have just a few relatively narrow or specific issues I want to highlight, and I don't look to have a conversation about them today, but as much as just put them on the staff's radar and follow up later. And they are these. In terms of the restaurant presentations, which I found very helpful, as I found all of the reports helpful today. So thank you to everyone who took the time to make the effort. In terms of the restaurant industry, I do think it would be helpful if we could hear at some point in the future, even off agenda, about the precautions that will be necessary to keep the staff in those restaurant industry settings safe. I am mindful of the fact that as someone is enjoying a meal, we hope in the immediate future on a patio in the wonderful weather, that there are a bunch of people working hard in what I'll call back of house. And I'm not an expert in the kitchen industry, but in the restaurant industry, but I know that every time I've had a chance to take a look, you've got an awful lot of folks working in very, very close quarters and very crowded conditions in the back of house. And these are folks who we know are in many cases disproportionately affected by the virus. They're people of modest income, and many of them are identified on our dashboards as being part of a racial or ethnic group that is disproportionately impacted. So I think that back of house operation is going to require our attention, and I would just ask that staff have that on the many things on their to-do list. The second thing I would say, and this one's a challenge, I know, but we've heard just once or twice today, but I thought it was an important point, and I certainly hear it from constituents, that they'd love to know what the schedule is, as in on a calendar, what the schedule is for various changes in terms of the public health orders, the so-called path back to normal. And I think people are very understanding actually when it's explained that that has to be based on good data about the virus and the direction things are moving, and that it's not something we can simply decide in advance without knowing when we get to a particular time what the facts out in the community are telling us makes sense from a public health standpoint. That being said, and this is an exhortation to our public health officials, if there was a way to loosely schedule and communicate to the public, we will be expecting to look at the data again at such and such a time, such and such a date, in such and such a month. And 3 days prior to such and such a date, we will plan to make an announcement, or a week or 5 days, whatever it is. I think that would be helpful. And I think there might be a hybrid there. Again, I'm not talking for a commitment about here's what's going to happen a month from now when we don't know what can happen a month from now. But I do think if, our public health officer, I think, has been very good about saying, look, every 2 to 3 weeks, we take another look at the data and we make the steps forward that we can make based on that data. Well, if there are another couple of cycles, one at the 3-week mark after the most recent changes, where we expect that's going to be the case, if we could put a little bit of a definition to the schedule, I think it would help people a lot. I think we heard that today from folks in a range of industries who in one way, shape, or form said, we can't pivot without knowing when we're going to be asked to pivot, and that's a challenge. Last thing I'll say, and this will come as no surprise certainly to my colleagues, I was struck by the number of folks who talked about the importance of testing and tracing. I am intrigued by the extent to which we might partner with private sector folks to sort of pull them into the effort to test and trace, to make them a force multiplier if that's possible in some way, to let them do what I'll call self-help in terms of testing on site. Supervisor Wasserman has wisely reminded us from time to time that the testing is only a snapshot, a moment in time. But the takeaway I have is that, that means we're going to have to test even more frequently with the same folks. So we need to stand up that testing regimen even more aggressively than we've been able to do to date. And what I'm hearing today is that that's going to be key to our ability to let these folks go back to work in a way that is safe. Last word is, I think, at the risk of stating the obvious, we all want to see things go back to normal as quickly as we possibly can. We also want to make sure that happens in a way that's consistent with public health. Striking that balance, threading that needle, however you want to describe it, is going to continue to be the challenge. And while our public health officer is ultimately the one who makes the call, I think it is helpful for us to have opportunities like today to inform that department's understanding of how all these decisions play out in the community and in our business, labor, and nonprofit world. Thank you very much.
Thank you.
Thank you.
Supervisor Wasserman.
Thank you very much, and thank you, Supervisor Simidian, for bringing up that point about the way we can serve as a conduit to the department, bringing in information from people living it each day and the impacts, positive and negative, that they can have. I do want to say I appreciate the efforts and the information received today and all the efforts being discussed about expanding businesses already open, like restaurants, going from to-go only as of yesterday to outdoor dining today. And of those restaurants that have outdoor areas, they can do it easily, and they have done it already. And everybody else working together to allow the other restaurants, as Supervisor Cortese has brought up, to be on an equal playing field and expand public, private, whatever, so that they can have patios. That's a way of allowing businesses already open and maybe receiving 20% of normal revenue to open further and hopefully get up around 50 or 60% of revenue. Second is retail. As of yesterday, retail could deliver packages or goods, sales, curbside. As of today, people can go inside. And obviously in each of these examples, there's a limited number of people and social distancing must be kept and they have to wear masks and all the rest. But I brought up those two examples, Madam President, as businesses that were already open yesterday that get to expand their existing open business today. What I'd like to see going forward are those mom and pops, those small businesses that are not currently open, they're getting zero. It's nice to go from 25% sales to 50 or 60% sales. It's very tough when you're still at zero sales. And as I look at the state's Department of Public Health website, and I look at that one item still left in there, the office-based is in early stage 2, and I've spoken with the Public Health Department, and they're totally right, that almost every office use is currently allowed right now, but not all of them. And that's kind of the last part of early stage 2. So those people who operate in an office that are not currently allowed are receiving zero income. I would bring up barbers and stylists again. I would also bring up indoor soccer. I talked to a person yesterday who's got a facility that's larger than most elementary school fields. There certainly could maintain social distancing between people. Gyms, again, you could limit the number of people that come inside. Yoga, where they bring their own mats and things are rubbed off alcohol, but it's inside. Dance studios, karate studios. These are all these small businesses that are currently prohibited from earning a single dollar, much less expanding their service yesterday from 25% of sales to 50 or greater. And I think if we just can look at, okay, we open up a studio, be it yoga or karate or whatever, and you maintain the social distancing. And we do that because I believe if you had a dance studio outside, it would be allowed. If you had a yoga studio outside, it would be allowed. If you had a karate studio outside, it would be allowed. Again, maintaining social distancing and all the other requirements. So I think we need to look at, okay, outside fresh air, being on grass, yes, that's nicer, but being indoors, as long as you maintain the distance, you maintain the distance. So thank you very much for hearing me out, and I look forward to future developments. You're muted, Madam President.
Thank you very much. And thank you very much for all of my colleagues' very thoughtful comments. What I would like to do is just do two things as a kind of a wrap up for today. One, I want to thank all the panelists, and I really want to thank my staff and the clerk's office who, really went to town to try to get everybody here and get their slides in order and all of that. And for any of you who are going to be participating on Monday, your slides are due right already. On Monday, we're going to have even more panels that we're going to work on getting through a single day. And I want to just thank everybody. I know 3 minutes is really hard, but we got written materials that were excellent from folks. I know IEM is going to be packaging those up. I would say on Mondays, at the end of Monday's time, what I'd like to recommend and prepare our staff for is that I want to make sure that there's a robust opportunity for us to dive back into the ideas that have been raised today and then be able to make some very broad recommendations to staff based on that. Let me just talk about Monday for a moment. We're going to be talking to faith institutions, transportation institutions, recreational and fitness facilities, arts and entertainment, hair, personal care, pets and grooming, athletics, hotels, lodging, and other large public events, and middle and high school, and then licensed professionals, including but not limited to dentists, optometrists, chiropractors, and veterinarians. So it's going to be a much longer day. we'll have worked out the kinks by Monday. So I'm really looking forward to engaging with all of you. What we're going to do now, just to wrap up the day, is we're going to go to public comment, which is item 4, and then we will adjourn. And again, I want to really just thank my colleagues and every panelist and the staff who were with us today. I think we got some great ideas about how to proceed, and was inspired by a couple of the things that I heard today. So with that, we'll go to public comment. And this is, we have one speaker on public comment.
The next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, everybody. Scott Largent. You know, it was nice for several months. I enjoy Starbucks here and there. You know, you haven't been able to go into, of course, a Starbucks when you don't have the ability to go through the drive-through. You know, you're kind of limited unless you have the real fancy app and the smarty phone that can handle that app. You don't get to do the online ordering, but it was kind of nice that the Starbucks downtown finally opened. You were able to go in there and walk up to the counter and, you know, of course, wear your protective mask. You know, they had hand sanitizer there. It was really neat. But what that Starbucks was going through is kind of the similar things before COVID. Is we have the severely mentally ill and homeless. They're primarily meth addicts. They have been left downtown throughout this entire COVID situation, and same with the rioting and the protesting. They are going into these businesses as they're opening up, asking for something as simple as water. And it's very nice that the Starbucks is willing to give out a large cup with ice and give it to that, you know, severely mentally ill meth addict. But we shut off all the drinking fountains downtown. We shut off the ability for people to get water. There are barely any fountains anyway. And then now these washing stations, due to the rioting and the protesting, have been used by all the protesters. So let's not forget the people that were left in the middle of all of this. And when we issued that, you know, that 8:30 curfew, those people were being hunted like rats also. And I was able to put together some more of those videos. It was really sad when you see tank-looking vehicles going through St. James Park, and you see severely mentally ill people getting zip-tied as if they were part of a riot, and they were just basically sleeping on a sidewalk trying to survive. So let's not forget these people that are out there. They're very thirsty. How about one of you go, pull that lever, push that switch, and get some water out there, get some resources, maybe some better toilets, some better washing stations, and not the ghetto ones. So thank you.
Thank you.
The next speaker is John. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello?
Yes, John, you're on.
Yeah. And to follow up on what Scott just said, I think what should have happened already is your Board of Supervisors should have been working on a homelessness issue we have in this county, which is very serious. Instead of shutting down businesses and telling them not to, not allowing them to for their livelihood and to do their businesses, and making people lose their whole life savings and their businesses. That's what should have been done. You should have been helping the homelessness. Okay. Another thing is, what is the current situation with the rent, the evictions? Okay. Myself and a lot of circle friends, we own properties here in this county. We have tenants that are laughing at us right now because you've extended the moratorium until I don't know when. It's even past the state one. They won't pay the rent. They're going to destroy our homes. We already have a homeless issue as it is now, because Scott just mentioned that, which should have already been addressed, but you folks are not competent to do that, okay? And by you doing this, extending the moratoriums on evictions, we're really going to have a homeless problem come another 6 months to a year. Yeah, everybody out there that's listening, you think we have a homeless problem now in Santa Clara County? You wait until after this moratorium that's been extended by our great county board of supervisors. You wait until that all plays out. We're really going to have the homeless problem we have now. We're going to be laughing at it 6 months or a year to now. Okay, and so that's all I wanted to add on this.
Thank you. Our last speaker on this item is going to be Sherry Burns.
The next speaker is Sherry. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Sherry,
Good afternoon. Again, I'm not Sherry, I'm Christine. To address one other issue that I hadn't touched on before, I'm still concerned very much so with trying to make sure that folks that need to get to testing sites can get to testing sites in an easy fashion if they cannot take fixed route buses for whatever reason due to their disability or disabling conditions. Making sure that they get transported to and from. As I understand it, the initial contact for them is to contact their medical service provider, but I'm equally concerned about those that don't have a regular service provider or don't have insurance, to make sure folks that need the rides get the rides, whether or not they have a power chair, manual chair, whatever it is, making sure they have access to accessible and appropriate transportation to and from testing sites in a timely fashion to reduce the exposure time. Thank you so much.
Thank you. I want to thank everybody one more time, and we are adjourned. Thanks, everyone.
Thank you.